answer, because this membrane is going to be there, and this membrane, when you try to peel off this membrane, it is going to bleed, right? This is going to be the thing, right? This pseudo membrane, most common location of this pseudo membrane is going to be fossil pillar. Remember, this is a bacteremia or a toxemia. Diphtheria क्या होता है, bacteremia या toxemia? बैक्टीरियमिया है या टॉक्सीमिया है? डिप्थीरिया क्या होता है? इट इज़ अ टॉक्सीमिया, इट इज़ नॉट अ बैक्टीरियमिया, इट इज़ अ टॉक्सीमिया. टॉक्सिन प्रेजेंट होते हैं डिप्थीरिया के ब्लड के अंदर, एंड दे आर गोइंग टू बी द टॉक्सिन्स विच आर गोइंग टू कॉज द डिजीज, है ना. ये प्रोटीन सिंथेसिस को इनिबिट कर देगा. दिस इज गोइंग टू inhibit the protein synthesis. This is going to activate your elongation factor, A B C D E F पढ़ा था, right? And this is going to cause what? This is going to cause disease, right? ये तीन जगह जाके disease करता है. First in the nerves, second one in the pharynx, and third one in the heart, right? In the heart it can cause what? Myocarditis, and this myocarditis is a complication. This is the reason for the डेथ ऑफ द पर्सन. नेक के अंदर क्या करेगा, नर्व्स के अंदर क्या करेगा? इट इज गोइंग टू कॉज पॉलीन्यूरोपैथी, एंड इन फेरिंग्स इट इज गोइंग टू कॉज व्हाट? इन्फेक्शन विच इज गोइंग टू कॉज सर्वाइकल लिम्फेडिनोपैथी, एंड दिस इज नोन एज व्हाट? बुल्स नेक, right? Cervical lymph nodes will get swollen up, they are going to get bigger, and this is known as what? Bull's neck, right? This is about the toxemia, right? And the treatment will be anti-diphtheric serum, and the dose is also has been asked, 80,000 to 1,20,000 is the dose we are going to give. This is the international unit, so this is going to be the anti-diphtheric serum we are going to give, है ना. Early cases में you can use erythromycin, but anti-diphtheric serum is something which is going to be a better option, right? The next thing we are having is Corynebacterium minutismum, which is going to cause what? Erythrasma. And in erythrasma you are going to get coral red fluorescence is going to be there. Under wood lamp you are going to find what? Coral red fluorescence is going to be there. Coral red fluorescent is going to be there. Bacteriophage, right? It is going to be normal diphtheroid are also there, right? Normal diphtheroid will convert into diphtheria causing bacteria with the help of this bacteriophage, and this process is known as what? Lysogenic conversion. This process is known as what? Lysogenic conversion. That means anywhere like you are having normal H. pylori infection, it is going to cause what? Peptic ulcer. Normal H. pylori is going to cause what? Peptic ulcer. But what happens if a bacteriophage, which is going to be a bacteria eating virus, right? This is going to be a virus. So when a virus is going to infect this bacteria, your bacteria, what will happen? This bacteria can convert into cancer causing this particular one can convert into, suppose you have normal H. pylori, now it is converted into carcinogen. It is going to convert into carcinogenic H. pylori, right? This process is known as what? This process of conversion is known as what? Lysogenic conversion, right? So with the help of bacteriophage, normal diphtheroid, which was commensal bacteria, can convert into diphtheria causing. This is also a lysogenic conversion, right? Simple understanding. Okay, so next question we are having, a 27-year-old male patient is presented with the abdominal pain. Patient is having pain in the abdomen, patient is having diarrhea, and a step ladder pattern of fever is there. Very important clue. He also complains of headache and malaise. His symptoms are gradually worsened over the past 2 weeks. पिछले 2 हफ्तों से खराब है. And he is also having relative bradycardia, right? Relative bradycardia is going to be there. Fever में tachycardia होना चाहिए, but this patient is having what? Bradycardia, right? And hepatosplenomegaly, and the sign is known as what? Relative bradycardia is known as what? Faggot sign, right? Which of the following is a diagnostic test here? Best diagnostic test पूछा है. First of all, what is your diagnosis? Diagnosis here is going to be what? Typhoid, simple typhoid, right? Typhoid will be having history. You will be finding a history of this patient might have had food outside, maybe the feco-oral route of transmission is going to be there, है ना. गंदा पानी पी लिया हो, गोलगप्पे खाए हो, बाहर खाना खाया हो, right? That is going to be feco-oral route. Characterized by step ladder pattern of fever. Step ladder pattern of fever, this is a fever which is increasing, right? On a gradual level it is going to increase. पहले 99, फिर 100, फिर 101, फिर 102, like that it is increasing, right, on a daily basis. This patient will also have some red color spots on the body. These are known as what? Rose spots. These are known as rose spots. And it can even lead to what? A diarrhea, special type of diarrhea that is known as pea soup diarrhea. Pea soup diarrhea. Pea soup diarrhea is going to be there, right? So here this is going to be the history. Now the common test that we are doing is the agglutination test. This is known as Vidal test, right? The agglutination test that we are doing. What is the mnemonic? The mnemonic for remembrance of these tests is going to be Basu. Basu, right? So B4, in first week you can go for what? Blood culture. In first week you can go for blood culture. A for agglutination test. Agglutination test, also known as what? Agglutination test, also known as what? Vidal test we are doing, right? S for stool test, you can go for what? Stool culture. And U for urine ELISA, right? So this is on the weekly basis. On the first week, what can be coming out to be positive? Blood culture. On a second week, you will be having Vidal positivity. Third week is going to be stool culture positivity, and fourth week is going to be what? Urine ELISA, right? So out of that, nowadays what we are doing, we can also go for another test that is going to be typhoid, because this Vidal is going to have this can be coming out positive in certain cases which are even not having the typhoid, right? So false negative are going to be, or false positive are going to be more, right? So we have to avoid this, and we can go for a better test which is going to be based on IgG IgM antibody. This is going to be typhoid, right? This Vidal is based on what? This Vidal is based on O and H antigen. So O and H antigen are the antigen we are going to look for. What are the antigen we have remembered? Your favorite batsman, can anyone tell me what were the antigens we have seen in a bacteria? What are the different antigens, right? So this is about the diagnosis of this particular thing, right? What are the enrichment media for this particular one? What are the selective media? What are the transport media? Enrichment media, selective media, and transport media for Salmonella. Yes, that is the Kohli. Very good, right? Kohli was the mnemonic, right? K antigen was there, O antigen was there, H antigen was there, and I antigen was there. K is for the capsule, O is for the outer membrane, right? H is for the flagellar antigen, L से कुछ नहीं, और I is for the pili antigen, right? Pili antigen. So these are the Kohli antigen we are having, right? So enrichment media is going to be what? Enrichment media for this particular one is going to be what? This is going to be again selenite F broth. So this is the same we have seen. Selenite F broth for Shigella, for Salmonella. Selective media for Shigella and Salmonella are going to be what? Same, right? But the selective media for Salmonella, Salmonella ने क्या किया था? दोनों, both of them are going to be what? Twin sisters. But this Salmonella has run away with Wilson. Wilson के साथ में भाग गई थी Wilson and Blair. Remember the story? और इसने मुंह कैसा कर लिया था? That is going to be black, right? Jet black color colonies. Jet black color colonies are going to be there. This is your selective media. Transport media is going to be same. This is going to be sex media. Shigella, Salmonella, transport media is going to be there, right? You can give ciprofloxacin, you can give azithromycin nowadays also. Azithromycin, and you can also give combination of azithromycin plus cefexime. Azithromycin plus cefexime. Normal dose of azithromycin is 500 milligram OD, right? But here you need to give what? 1 gram. Here you need to give loading dose, and then you can shift this patient for a longer treatment, right? Cefexime also you are going to give 400 milligram, right? BD. Normal dose is 200 milligram BD. Normally कितना देते हैं? 200 milligram BD देते हैं, right? So this is how you can treat your patient, right? Here you can have ulcer formation also. What kind of ulcer you will be finding in typhoid? Remember, typhoid can cause longitudinal ulcer. Longitudinal ulcer can be seen in the typhoid, right? Longitudinal ulcer can be seen in the typhoid cases, right? All right, the next question. A 55-year-old female comes to the outpatient department. A 55-year-old female comes to the OPD, right? Complaining of fever, cough, muscle pain, and headache. On taking occupational history, she reveals she is working in a central AC system corporate company, right? The doctor sent a sputum sample for culture sensitivity, and the microbiologists use the buffer charcoal yeast extract, BCA. Remember BCA? BCA, right? What was the suspected organism? Which of the following is mostly likely the diagnosis? What can be the diagnosis here? BCA is the culture media, right? What can be the diagnosis here? Is it a Legionnaire disease? Is it a brucellosis? Is it a mycoplasma or pneumococcus? The answer for question number 8 is going to be what? You tell me. Is it a first week? Is it a second week? The time period is already given past its second week. So what we can go for? We can go for Vidal test. Past second week is going to be what? Vidal test. Yes, correct. Okay, so a 55-year, the same story, try to answer. What about this mycoplasma and pneumococcus? What you learn about this mycoplasma and pneumococcus, right? This patient is having what symptoms? Patient is having symptoms of OPD. She is coming with the symptoms of fever, cough, muscle pain, headache, right? Cough, fever and headache. They and sputum sample is given. So they are talking, probably they are talking about some symptoms of lungs. So this can be a positivity about the pneumonia. This can be going in the terms of pneumonia beta, है ना? तो ये देखो तीन diseases are very common and very important from microbiology as per se, right? What are these 3 diseases? One is meningitis, second one is endocarditis, third one is this pneumonia. They are asking definite question from here, right? So this pneumonia, they will be writing symptoms like patient is having cough, है ना? कफ होगा पेशेंट को, कोराइजा होगा, नॉर्मल फीवर होगा, हेडेक हो सकता है, कफिंग प्रॉब्लम्स विल बी देयर, स्पूटम विल बी देयर, राइट? सो स्पूटम एग्जामिनेशन दे रखा हो, एक्सरे दे रखा हो, कफ दे रखा हो, फीवर दे रखा हो, इन्फ्लामेटरी चेंजेस आर देयर, मसल पेन एज वेल एज हेडेक. दिस इज गोइंग इन द फेवर ऑफ व्हाट? Pneumonia. Now what from these things can cause pneumonia? Legionnaire, yes sir, it can cause pneumonia. What about this brucellosis? Brucellosis, they must be giving you some other history. Brucella is something common with the cattle. Brucella is something which is common with the cattle, and apart from this particular thing, you will be having other symptoms of this particular one is going to be what? Hepatosplenomegaly should be there. You can have definitely myalgia as a component, but apart from that, you will be having what? Arthralgia, myalgia as a component, but apart from that, other symptoms should be given for the brucella, right? This is going to be a cattle handler or a person coming from the village for long-term fever should be there, right? What about this mycoplasma and pneumococcus? We already know pneumococcus, also known as streptococcus pneumonia, is most common cause for typical pneumonia. It is a most common cause for typical pneumonia, whereas this mycoplasma is a most common cause for atypical pneumonia. Atypical pneumonia, right? Most common cause for typical pneumonia is typical is pneumococcus. Atypical is going to be what? Mycoplasma. This pneumococcus, what is going to be the culture media you are going to use? The culture media would be different, right? For pneumococcus, that you can use what? CVBA, right? You can go for something like blood agar or chocolate agar. Basically blood agar is going to be the more appropriate one, right? This is going to be what? Pneumococcus. Mycoplasma does not even have cell wall, right? This is going to be most common cause for atypical pneumonia. But what about this Legionella? Legionella, only 2-3 words you have to remember, very important. This Legionella, central AC, I told you, Legionella or legions, Legionella, right? Central AC, very important. Dirty water and BCE, buffer charcoal yeast extract, very important. These 3 terms you will be finding with the Legionella, right? And the drug of choice is going to be what? This is also a type of atypical pneumonia. This is also a type of atypical pneumonia. So the drug of choice in this case is going to be what? This is going to be azithromycin. In fact, we are using this azithromycin for 4 indications. This is going to be the mnemonic clap. C for chancroid, it is the drug of choice, chancroid. L for Legionella. A for atypical pneumonia, which is also a type of same thing, Legionella. And P for pertussis, right? This is the case where the drug of choice is going to be your azithromycin, right? So let's try to understand what is this typical and atypical pneumonia, what are going to be the symptoms, right? So in typical and atypical pneumonia, remember consolidation is something which is a feature of what? Consolidation is something, अगर consolidation दे रखा है, damage दे रखा है, opacities दे रखी है, right, that is going to be a feature of typical pneumonia. एक्सरे के अंदर typical pneumonia, right, and typical pneumonia the most common cause is what? Pneumococcus. Pneumococcus is the most common cause for typical pneumonia. typical को typical क्यों बोलते हैं? Because the disease will be low. Disease will be low, but the symptoms are going to be more symptoms, less disease. This is a feature of typical pneumonia, pneumococcus, right? Second cause is going to be what? It can be due to staph also. Staph aureus. Staph aureus is generally associated with the nosocomial type of infection. Most common nosocomial cause is going to be what? Staph aureus. You can also have ventilator associated patient. You can have pseudomonas. In certain books it is written like Acinetobacter also. In pediatric age group, worldwide if you see, that is going to be what? Acinetobacter. So ventilator associated pneumonia, you can remember this. You can also remember this at ventilator associated pneumonia, but this pseudomonas is also associated with cystic fibrosis patient. Right? Pneumococcus is the most common cause of pneumonia, most common, right? So these are the typical pneumonia, मतलब disease तो कम होगा, symptoms ज़्यादा होंगे. On the other hand, we have got atypical pneumonia where the disease will be low. Atypical में क्या होगा? Symptoms will be low and the disease will be more. So when you go for HRCT or CT scan, you will be finding disease ज़्यादा है लेकिन symptoms कम है. The most common important cause is going to be what? Mycoplasma. यहाँ पर आप नॉर्मल सेफ्ट्रैक्सोन, एमोक्सिक्लेव वगैरह यूज़ में ले सकते हो. थर्ड जनरेशन सेफेलोस्पोरिन्स, योर सेल वॉल सिंथेसिस इनहिबिटर्स आर गोइंग टू बी इफेक्टिव हियर. मेरोपेनाम, पेप्टाज सब चलेगा, राइट. बट माइकोप्लाज्मा इज गोइंग टू बी अ निमोनिया विच इज गोइंग, माइकोप्लाज्मा डज नॉट हैव सेल वॉल. तो क्या आप सेल वॉल सिंथेसिस इनहिबिटर यूज़ में ले पाओगे? दिस इज द मोस्ट कॉमन कॉज फॉर एटिपिकल निमोनिया. नो, right? So you are going to use what? Azithromycin, and that is the reason we are taking azithromycin. जब भी थोड़ा खांसी जुकाम होता है आप azithromycin ले लेते हो, right? Second, the one we have seen just now, this is going to be Legionnaire's pneumonia with the central AC or dirty water. Pecoral root will be there, dirty water, right? Third one is important. This is going to be what? Chlamydia pneumonia can be there. Chlamydia with the bird handlers, those are going to handle the bird, they can have also the same thing, right? That is why the reason we have stopped the pigeon feeding also, right? And the fourth one is going to be a viral cause like COVID-19. They are going to have what? Atypical pneumonia, right? The symptoms are going to be less, disease is going to be more. In COVID also the same thing is happening. So patient को खांसी जुकाम हो रखा है, but ultimately he is going to have a lot of disease, right? So these are the common things about this particular one, right? Alcoholic patient में अब आपसे पूछा जाएगा तो you will be marking the answer. That is going to be most common cause is going to be Klebsiella, right? You will be finding what? दो finding और दे देंगे आपको. bulging fissure, one is going to be red currant jelly sputum and bulging fissure sign. In an alcoholic patient, your answer will be Klebsiella. Atypical में we have seen Mycoplasma, Chlamydia, Legionella and viral infections, right? Cystic fibrosis we have seen Pseudomonas. COPD के patient में most common cause is going to be what? Pneumonia as well as your Haemophilus influenza, and that is the reason we are giving Haemophilus influenza B vaccination. This Haemophilus influenza can cause meningitis, it can cause pneumonia, it can cause epiglottitis also, right? Very, very important. HIV positive patient, most common cause of pneumonia is going to be what? Pneumocystis cerevisiae, CD4 count less than 200, very, very important. Ventilator associated pneumonia, Pseudomonas, Acinetobacter, nosocomial is going to be Staph aureus. Very important list, you can remember this, right? CD4 count अगर 50 से कम दे रखा है, you can think about cytomegalovirus or Mycobacterium avium complex. CD4 count less than 100, toxoplasma can be there, right? And CD4 count less than 200 is PCP, plasma cell pneumonia or pneumocystis cerevisiae pneumonia, right? Same thing, pneumocystis cerevisiae pneumonia. And if it is more than 500, most common opportunistic infection is going to be what? TB, right? CMV के लिए the drug of choice cytomegalovirus, the drug of choice is going to be ganciclovir, right? What is the probable diagnosis for a farmer? ये समझ में आया, right? The answer here is going to be what? Definitely A is going to be the answer, right? ब्रूसेला के लिए ड्रग ऑफ चॉइस क्या है? ब्रूसेला, ब्रूसेला के लिए ड्रग ऑफ चॉइस इज गोइंग टू बी व्हाट? डॉक्सीसाइक्लिन. Brucella, leptospira, the drug of choice will be doxycycline, right? What is the probable diagnosis for a farmer who has got a swollen foot and multiple sinuses are going to be there as shown in the image below? What is going to be your diagnosis? So this is going to be a simple understanding. Is it chromoblastomycosis? No, it is not colorful, right? Sporotrichosis? No, there is no lymphocutaneous lesions are there, right? And what about squamous cell carcinoma? Sir, it could be a cancer, but this is the patient who is having sinuses. In cancer, you are not going to find any sinus openings is not going to be there. Some discharge is not going to be there. So discharge and sinus along with the swollen foot, this is going to be what? This is going to be a mycetoma. Mycetoma, and this mycetoma madrula foot is going to be of two important types. One is going to be what? It can be bacterial also, it can be fungal also. Bacteria can also be involved and fungus can also be involved, right? Bacteria can get involved and fungus can get involved. Fungal, you will be having single or generally single sinus will be there, and it is also going to be of black color discharge. Fungus is known as what? Eumycetoma, right? And bacterial is going to be due to actinomycetoma. Actinomycetoma. Here you will be having white to yellow discharge will be there, right? For the treatment per se, if you talk about, this is going to be antifungal you can use, and here you can use antibiotics, है ना? Welsh regimen हम लोग use में लेते हैं. Welsh regimen is something we are going to use here in the bacterial one, whereas here you will be using antifungal. If it is not effective, which is generally not effective, you need to go for what? Amputation. Amputation, right? Since the bacterial infections are going to be what? Acute. Generally they are acute. इनमें दर्द होगा because they are painful. तो इनमें ज़्यादा दर्द होगा तो पेशेंट जल्दी आ जाएगा. But the fungal infections are going to be chronic since they are going to be what? Painless. तो फंगल इन्फेक्शन लंबे समय तक रहते हैं बिकॉज दे आर पेनलेस, है ना? इनमें इचिंग विचिंग हो सकती है बट दे आर गोइंग टू बी जनरली पेनलेस. सो आंसर इन दिस केस इज गोइंग टू बी व्हाट? दिस इज गोइंग टू बी mycetoma. Okay. What is the probable diagnosis for a 35-year-old patient who is HIV positive and this patient is exhibiting some mucosal lesions, right, in the mouth as shown in the provided image? Image is missing here, right? With the presence of budding yeast and pseudo hyphae. Pseudo hyphae and budding yeast, very very important clue that you are having. In HIV positive means immunocompromised patient. First thing HIV positive means you understand is immunodeficiency. Immunodeficiency, right? HIV positive patient, most common cause of meningitis we have discussed in the first question, that is going to be cryptococcal meningitis. Most common cause of pneumonia, that is going to be pneumocystis jirovecii pneumonia. Most common cause of diarrhea is going to be what? HIV positive patient. Very very important, they are asking one question from here. Most common cause of diarrhea in HIV positive patient is going to be coccidian parasites, right? And HIV positive patient with CD4 count 500, that is going to be what? Tuberculosis. ये 200 पे जाएगा तो pneumonia हो जाएगा. This is how this thing is going to get worsen, right? And we are going to start the treatment of HIV positive patient irrespective of the CD4 count nowadays, right? तो अभी हम लोग जैसे ही HIV positive suspect हुआ, we can start the treatment, right? So what is a other common infection that can happen because of immunodeficiency? You can have what? You can have any of this. So patient is exhibiting what? Mucosal lesions in the mouth, right? So diphtheria, you will be having pseudomembrane. We have learned about this diphtheria. So diphtheria, we have learned about the pseudomembrane which is going to bleed on removal. This is what we have learned, bleed on removal. So इसको जब हटाएंगे तो इसमें से bleeding होगा, yes or no, right? Second thing is lichen planus. Lichen planus we have learned about. You will be having mucosal involvement, yes or no? Yes sir, mucosal involvement is going to be there. And what is the mucosal involvement? You will be having white lacy reticular pattern, which is also known as Wickham striae. Wickham striae, right? And what about this oral hairy leukoplakia? Sir, this thing can also have this type of lesions are going to be there. So corrugated appearance is going to be there. Corrugated appearance, right? But since the image is missing, it should be having a image of what? Budding yeast and pseudohyphae. This is going to be a feature of what? Fungus. Budding yeast and pseudohyphae is a good feature of what? Fungus. Yeast and hyphae are something which is a feature of fungus, and out of them the only one which is going to have a fungal disease, this is going to be what? Oral candidiasis, which is common when you have immunodeficiency, when you have decrease in the immunity, this thing can happen, right? And what are the things about this candida you have to remember? Candida, you can remember two important phenomena they can write you. This is going to be what? First thing is Raynaud broad phenomena. Raynaud broad phenomena, which is nothing but the germ tube test or germ tube formation. Germ tube formation is a feature of candida. Second is your chlamydospores. Chlamydospores on corn meal agar. Chlamydospore on corn meal agar, right? In corn meal agar, it is going to show you chlamydospores, which is going to be seen in the lactophenol cotton blue, which is going to be showing you blue color spores are going to be there, right? This particular thing is for the identification of the species. This is known as chrome agar. Chrome means colorful agar, right? For identify the species, for identification of species, identification of different species of candida. Different species can be differentiated on the basis of this particular thing. We can identify the different species of candida, right? How you can do the culture of this particular thing? You can culture, and the culture media for everything, every fungus is going to be SDA. This has been asked previously, your last exam question. This is going to be the SDA, Sebrod dextrose agar. Sebrod dextrose agar. Sebrod dextrose agar. So सारी फंगस को यहाँ आप लोग डाल सकते हो. You can put it here, right? You can also do beta 1,3 glucan assay for confirmative diagnosis. Glucan assay, right? For the treatment, if you are having multiple diseases you can have because of this candida. If this candida is causing oral thrush, candida oral thrush is given, then you can give what? Then you can give clotrimazole ointment. Clotrimazole ointment. Candid mouth paint we are having, since it is easily reachable, right? Why to take fluconazole? You will mark the answer. Fluconazole is the drug of choice, everybody knows this, but fluconazole will go to your mouth, it will go to your stomach, then it will get digested, then it will come to the enterohepatic, sorry, it will come from the intestine to the blood, right? It will get absorbed in the blood, and then this will travel all the way in the blood, and it will come to the tongue, right? It's a long path. You can go simply, you can take direct oral medication, you can apply directly on the superior surface of this particular thing, and you can get rid of this candida also, right? So wherever you can reach easily, why to take systemic drug, right? So clotrimazole ointment you can use, right? That is going to have what? That is nothing but the candid mouth paint we are having. Fluconazole is the drug of choice. Fluconazole. So this is drug of choice for those places which is having a difficulty in reaching. Like for example, if you have vaginal candidiasis, what you can do? Vaginal candidiasis, you can use what? You can use pessaries, right? You can use what? Pessaries you can use, right? You can directly inject the drug. You can directly inject the drug into the vaginal vault, and this is going to work locally, and this is how you can kill this vaginal infection also, right? Fluconazole is the drug which you can give for esophageal candidiasis, which is esophageal candidiasis, candida, right? You cannot reach to the esophagus very easily, so you can use what? Esophageal or systemic candidiasis, you can use this drug, right? So this is pretty much about the candida, right? The next question we are having is which dimorphic fungus listed below is responsible for causing subcutaneous mycosis where lymphatics are involved? Subcutaneous fungus, right? What are the subcutaneous fungus we are having? The subcutaneous fungus we are having is MRCS. Remember, we have learned in the same manner. First, superficial dermatophytes we are having, all the superficial infections we have seen, right? Then we have discussed about the subcutaneous, and then we have learned about the deep funguses, right? So subcutaneous is going to be MRCS. M for you will be having what? Mycetoma. R for rhino. sporadiosis, rhinosporidiosis. C for chromoblastomycosis, and S for sporotrichosis, right? So which of them is going to be not involved here? The answer here is going to be what? The answer is simple. MRCS will be having what? A sporotrichosis. What about the histoplasma? Remember the mnemonic that we have discussed? HI, that is going to be high. This is going to be high Darling disease. Yes, Darling disease, Ohio disease, right? This is also known as Darling disease, Ohio disease, right? Caves disease. Caves disease. Remember, hi darling, let's go to cave, right? And in cave you will be finding what? You will be finding bats and birds droppings will be there. Bats and birds droppings will be there, and this droppings will, this patient is going to inhale, is going to have a TB like disease, TB like symptoms will be there. This is going to resemble the TB. This is known as what? Histoplasmosis, right? And here it is a disease which is going to have what? Macrophage is going to have what? Macrophage is going to engulf the cells, right? These cells are going to be present inside the macrophage. This is going to be the picture you can get, right, inside the macrophages, right? What about this blastomycosis? Blastomycosis is also known as North American disease. This is known as North American disease. These are the North American disease we are having. This is known as what? Blastomycosis. Remember this blastomycosis, B is looking like 8, so this is going to have a figure of 8 appearance will be there. So you will be having what? Figure of 8 appearance will be there, right? And this is going to show you broad based budding. This is also important. What kind of budding will be there? Broad based budding, right? So histoplasma is also narrow based. This sporotrix is also narrow based budding. Here also histoplasma you will be finding narrow based budding, but in blastomycosis you will be having what? You will be having broad based budding. Figure of 8 appearance will be there, and this is going to have what? Blastomycosis. And this coccidiomycosis is going to cause what? Desert rheumatism. Remember desert rheumatism, right? Rheumatic symptoms, right? Rheumatic symptoms means whatever symptoms you will be finding in the rheumatic, these are the symptoms you will be having. This is also known as Sau-Jacquin Valley fever. Sau-Jacquin Valley fever, right? So this is something about the coccidiomycosis, right? So now let's talk about the important one. This is going to be your sporotrichosis. So what is sporotrichosis? Sporotrichosis is something which is caused due to Sporothrix shanki, right? Sporothrix shanki is going to be the causative agent. Here you will be having yeast cell which is surrounded by pink eosinophilic material, right? So in center you will be having yeast cell which is surrounded by pink eosinophilic. Eosinophilic means pink color material. And this complete body is looking like asteroid, so this is known as asteroid body. This thing is going to happen because in the rose gardeners around the time of Valentine also, so this is going to be also known as Valentine disease, right? And what kind of sporulation will be there in the mold? This is going to be flower like sporulation, cigar shaped narrow based budding, right? Lymphocutaneous spread is going to be there. It is going to spread along with the lymphatics, right? So this is going to have lympho plus cutaneous involvement, and the drug of choice is going to be what? Itraconazole, right? One phenomena you will be finding here is going to be Splendor-Hopley phenomena, right? Remember the story that we have discussed around it, right? Splendor-Hopley phenomena, right? This is going to be what? Sporotrichosis. The next one we are having, what is the probable microorganism causing the pruritic hypopigmented macules? Pruritic hypopigmented macules is a splat lesion, right? Confluent patches are going to be there over the chest, on the trunk of a 24-year-old male patient. The skin scraping and QH preparation exhibit numerous yeast-like cells. Yeast means they are talking about fungus, short branched filaments resembling the appearance of spaghetti and meatball. Very, very important. Spaghetti and meatball appearance is something you will be finding along with the Malassezia furfur or Malassezia globosa. This is going to cause a disease. What is the name of the disease? The name of the disease is going to be what? Pityriasis versicolor. Pityriasis versicolor, right? Pityriasis means scaling, versi means different color, different color. Pityriasis means scaling, versicolor means different color. Different color means what? You can have hypo as well as hyperpigmentation will be there. Hypo and hyperpigmented lesions are going to be there, and this is simple. When you are going to put these lesions into when you are going to take the scraping, you are going to put the scraping under the KOH, you will be finding what? Spaghetti and meatball appearance. Spaghetti and meatball appearance will be there. Very, very important, multiple times has been asked. And when you are going to keep the same lesion on the SDA, keep the same sample on the SDA, you will be finding what? You will be finding fried egg colonies. You will be finding fried egg colonies will be there. And this fried egg colonies you are also going to find somewhere else. Try to tell me what other two locations you have, or what are the other locations you have learned about the fried egg appearance. Try to answer, right? So this is going to have fried egg colonies, right? The trichophyton is a normal dermatophyte we are having, normal dermatophyte, which is a superficial skin infection, which is going to involve all three things like your skin, your nails and your hairs, right? Pityriasis rosea is something. Pityriasis means again scaling will be there, and rosea means red color. Rosea is going to be rose like or red color, scaling will be there, right? So what is going to be the thing you will be finding in pityriasis rosea? Here you will be having the one patch is going to be there, which is known as what? Mother patch. First patch, this is also going to be on the trunk. This is going to be R4R, you need to remember. This is going to be red, right? And this patch is going to be there, and along with the patch you will be having what? Appearance of other patches in a Christmas tree pattern. What kind of pattern? Christmas tree pattern. Christmas tree pattern, right? And this particular one, mother patch, is also known as herald patch. Mother patch or herald patch, उसके बाद में क्या होगा? Multiple lesions are going to be there, right? So this is a mother patch, this is a herald patch. When you are going to see for the scaling, you will be finding the scaling here and here also. Here you will be finding what kind of scaling? This is going to be having fine scales or rice powder like or bran rice powder like or briny scales will be there, right? Whereas here you will be finding what? Cigarette paper like scaling. Cigarette paper like scaling. Very, very important. These two things are confusing. One more pityriasis you have to remember, that is going to be P. alba. Pityriasis alba. Pityriasis will also have scaling, and alba means white. So you will be having a solitary white color lesion on the this is seen in the children, है ना? तो बच्चे आएंगे आपके पास में with a white color lesion. It can be multiple, it can be on the body, multiple parts of the body. तो pityriasis alba is going to happen in the children. उनको लगेगा hypopigmented lesion है. What is the differential diagnosis? Differential diagnosis is going to be indeterminate leprosy. Indeterminate leprosy, this is important. You need to differentiate between these two things, indeterminate leprosy versus this pityriasis alba, right? This is going to happen in the children, right? Indeterminate leprosy will be having hypoanesthetic lesion, उसमें anesthesia होगा. Pityriasis alba में क्या होगा? Scaling will be there. Pityriasis का मतलब ही scaling है. अगर स्केलिंग मिल गई मतलब सर टेंशन लेने वाली बात नहीं है. इट इज़ गोइंग टू बी सेल्फ लिमिटिंग कंडीशन. इफ स्केलिंग इज एब्सेंट एंड hypoanesthesia is there, this is the leprosy, right? Which is common in some areas, some endemic areas like बिहार, है ना, उस साइड में कॉमन है, झारखंड, बिहार, राइट? सो दिस इज गोइंग टू बी व्हाट? इनडिटर्मिनेट लेप्रेसी वर्सेस P. alba. अब दो pityriasis और याद रखने हैं, दैट इज गोइंग टू बी pityriasis rosea, अनदर वन इज pityriasis versicolor. Pityriasis का मतलब स्केलिंग होता है, तो स्केलिंग इनकी याद रखनी है, राइट? So this is going to be the scaling we are having, right? Usually they are self-limiting. If you want, you can give selenium sulfide, right? You can give antifungals. This is going to be fine, right? Okay. What about vitiligo? Vitiligo is something decrease in the decrease in the melanin, and because of that, what will happen? You will be having white color patches will be there, right? But this is not going to have what? Yeast like short branching or spaghetti and meatball is not going to be there. So answer in this case is going to be what? Malassezia furfur or Malassezia globosa has been asked previously. Okay, wonderful. We have got two answers, right? This particular fried egg colonies, you can make a same note. Fried egg colonies you will be finding in the mycoplasma also on a poplar agar. You can also find this fried egg colonies in oligodendroglioma, right? Non-Hodgkin tumor, right? We are having chicken wire appearance, multiple things you will be having. That is going to be oligodendroglioma, right? So these are the three structures with the fried egg colonies, right? This is also done, right? The next one we are having another question. A 14-year question number 14. A patient presented with the complaints of persistent dry cough. Now the patient is having dry cough, fever, and weight loss. Right? What you will suspect? Dry cough, fever, weight loss. I think about, like, do you think something about, like, looking at the symptoms? We think about TB. TB might be having what, cough, but sir, not dry cough. It would be having a wet cough, right? Sputum would be coming, fever will be there, mild fever, nighttime fever generally happening in the TB. Weight loss is a common feature of TB. Bleeding, or you can say hemoptysis is a common feature of TB. है ना, एक पेशेंट आता है हेमोप्टाइसिस लेके, फर्स्ट थिंग यू थिंक अबाउट द पेशेंट माइट हैव टीबी, right? He was diagnosed with HIV. Okay, this patient is having HIV, immunodeficient patient. He might have TB also, right? Positive 6 months back and is poorly adherent to his medications. वो दवाई नहीं ले रहा. GMS, Gomori methiomin silver. It is a type of impregnation method of staining. Remember GMS? I told you in the first question. Methods of staining: simple stain, negative stain, right? Impregnation method of staining, differential stain. So this is a impregnation method of staining. We are putting what? Silver. On which sample? On the sample of ball. What is ball? Bronchioalveolar lavage, right? And this is going to reveal what kind of appearance? Crushed ping pong ball appearance you are finding in GMS. What is the most likely causative agent? Most likely causative agent in this particular case is going to be what? Is it a paracoccidioides? Is it a histoplasma, again coccidioides, or pneumocystis cerevisiae? So let's try to rule out this paracoccidiomycosis. We have seen this is going to cause what? South American disease. Remember, one is North American, one is South American. We have earlier seen about the North American one, right? This is your paracoccidiomycosis, which is going to cause what? South American disease, right? And you are going to look at the yeast cell. This is a dimorphic fungus, so you are going to find what? Mickey Mouse appearance, very very important. Mickey Mouse appearance, or pilot wheel appearance, or mariner wheel appearance. Pilot wheel or mariner wheel, right? So this thing can happen, right? Histoplasma is happening. Histoplasma, we have just now seen. You will be having what? Tuberculate macroconidia. It is going to mimic what? TB. It is going to mimic what? TB. ये TB जैसा हो सकता है. There might be possibility, right? But we can simply understand this thing. This is not going to be using what? Gomorium, methiomin, silver stain, and not going to show you ping pong ball appearance. Coccidioides, we have seen this is going to be coccidiomycosis, going to cause again desert rheumatism. Desert rheumatism, right? It is associated with the soil or dust exposure. Soil or dust exposure. So this is not going to be the picture here, right? What about this pneumocystis cerevisiae? This is going to cause what? Pneumonia. In which patient? Very very specifically HIV positive patient. This pneumonia is going to be known as plasma cell pneumonia or pneumocystis cerevisiae pneumonia, right? This is going to be the pneumocystis cerevisiae pneumonia or plasma cell pneumonia. What can happen here? This is the appearance you are going to find, right? This pneumocystis is a fungus as well as protozoa. This is a fungus as well as protozoa. This is a joker, like it will be having what? Protozoa will be having what? Cyst and trophozoites will be there, right? And it is also going to show you these hyphae kind of situations, right? So when you are going to do Gomorium, methiomin, silver stain, you are going to put on what? Silver. You are going to find this appearance. Can you appreciate this appearance? These appearance are looking like a crescent bowl, half bowl, crescent moon like shape. You can appreciate this is looking like a half moon, right? So this is going to give you on Gomorium, methiomin, silver stain, you are going to get a black color structure, right? And this black color structure is going to give you appearance of crushed ping pong ball. Crushed ping pong ball appearance will be there. Ping pong ball appearance will be there. Or this is also known as, sometimes we call it what? Crescent shape, moon like, right? So this is going to cause what? Pneumonia, right? They can also give you some other sign in this pneumonia. When you are going to do the X-ray or CT, you will be finding what? Because of this infection, you will be having a non-specific, yet you will be finding this is going to be perihilar opacity. Around the hilum, you will be finding white color lesions. This is known as what? Perihilar opacities will be there. right? And this perihilar opacities are going to be seen along with the miliary mottling, right? Miliary mottling, जैसे miliary TB होता है, you will be having multiple small opacities are going to be there, white lesions are going to be there. Miliary TB मतलब systemic TB, पूरी body में TB फैल गया, right? So here you will be finding perihilar opacities with miliary mottling. The drug of choice for this particular case has been asked. The drug of choice for this particular one is going to be cotrimoxazole, which is a combination of trimethoprim plus sulfamethoxazole, right? So this is a combination of trimethoprim plus sulfamethoxazole. This is a cotrimoxazole we are going to use, right? This is the same thing we have discussed earlier, right? So this is the question. The answer will be pneumocystis cerevisiae, pneumocystis cerevisiae. The next one, we are having a HIV positive patient coming to the clinic with a history of diarrhea now. The patient is having diarrhea, HIV positive patient with the diarrhea. Stool microscopy shows what? Oocyst, and the size of the oocyst is what? 4 to 8 mm. The image below is going to be there, right? And what is going to be your diagnosis? What is going to be your diagnosis? HIV positive. We have seen multiple cases in HIV positive. Remember, you are not going to make this question wrong. HIV positive pneumonia, your answer will be plasma cell or pneumocystis cerevisiae pneumonia. CD4 count is going to be 200. HIV positive patient with meningitis, your answer will be what? Your answer will be Cryptococcus neoformis, right? HIV positive patient with massive watery diarrhea, your answer will be coccidian parasites, or better is going to be Cryptosporidium parvum. सारे करा सकते हैं, but the most common is Cryptosporidium parvum, right? And HIV positive patient, some lesions, oral lesions, you will be think about what? Candida is a common infection, Candida, right? And most common opportunistic infection is going to be what? Tuberculosis. Opportunistic infection in HIV positive patient is going to be what? TB. So these are some common things you have to remember about HIV positive patient, right? All of you are marking the answer C. All of you are marking the answer C. So answer to this question is going to be what? Let's try to understand this question. So we have got the size of the oocyst is already given. Size is given, that is going to be 4 to 8 micron, right? So we have got 3 organisms here, and all of them are going to be what? They are acid fast. Acid fast means they have a covering of mycolic acid. Whatever organism is having a covering of mycolic acid on the outer cell wall में अगर किसी के mycolic acid है, तो we can put what? Carbonyl fusion dye, and we can make a compound, and this is known as what? Acid fast organism. This organism is known as what? Acid fast. जैसे टीबी है, तो टीबी का नाम क्या रख दिया? माइकोबैक्टीरियम. क्यों रख दिया माइकोबैक्टीरियम? दिस इज अ बैक्टीरिया विद mycolic acid, right? The same bacteria, these are also acid fast bacteria, they are having mycolic acid in their cell wall, so we are going to add what? Carbonyl fusion dye, right? So these are the 3 organisms we are having: Cryptosporidium parvum, Cyclospora and Isospora. They are going to cause HIV positive patient massive watery diarrhea, 0.25 to 1% acid fast है, right? But तीनों ही acid fast है, तो how we are going to differentiate between which one is Cryptosporidium, which one is Isospora, which one is Cyclospora? So for that we have got the simple understanding. जिनके भी नाम C से start होते हैं, you can understand Cyclospora and Cryptosporidium. Both of them are going to be what? Round. Whereas this I1 is going to be what? Longitudinal. This I is looking like a longitudinal, so this is going to be what? Longitudinal, right? तो अगर ऐसा कुछ दिख रहा है अपीयरेंस, दिस इज गोइंग टू बी व्हाट? आइसोस्पोरा. अगर राउंड दिख रहे हैं, तो या तो साइक्लोस्पोरा होगा सर, या फिर आइसोस्पोरा, सॉरी साइक्लोस्पोरा होगा, या फिर क्रिप्टोस्पोरिडियम होगा, राइट? दिस इज समथिंग यू कैन अप्रिशिएट. फर्स्ट थिंग. सेकेंड थिंग, यू कैन ऑल्सो अप्रिशिएट इनके साइज अलग अलग है, राइट? ऑल ऑफ देम आर एसिड फास्ट. सारे एक जैसे दिखेंगे, तो साइज के बेसिस पे वी आर गोइंग टू डिसाइड. अगर 4 से 6 माइक्रोन है, नाम बड़ा क्रिप्टोस्पोरिडियम पार्वम, साइज छोटा 4 to 6 माइक्रोन. Cyclospora, cycle में you can calculate, this is going to be coming out to be 10, you can appreciate this is going to be 8 to 10 micron. And this isospora is going to be the biggest one, that is going to be 23 to 36 micron, right? Apart from that, you can also appreciate, अगर ये सारे स्टैंड है, सारे अगर स्टैंड दिख रहे हैं, दिस इज गोइंग टू बी, सर राउंड इमेज था बट वी आर नॉट एबल टू आइडेंटिफाई, अगर सारे स्टैंड दिख रहे हैं दैट मीन्स दिस इज क्रिप्टोस्पोरिडियम पार्वम। अगर साइकिल है, साइकिल में रिमेंबर इफ ऑल स्टैंड, सब ने कलर ले लिया, दिस इज गोइंग टू बी क्रिप्टोस्पोरिडियम। इफ साइक्लिकल इज देयर, साइक्लिकल स्टेनिंग इज देयर, मतलब कुछ में कलर आया कुछ में नहीं आया, सम ऑफ देम आर गोइंग टू बी स्टैंड, सम ऑफ देम आर नॉट स्टैंड, कुछ ऐसे ही दिखेंगे वाइट कलर के, सम ऑफ देम आर नॉट स्टैंड, दिस इज गोइंग टू बी व्हाट, साइक्लोस्पोरा। दिस इज हाउ यू कैन डिफरेंशिएट, है ना, लॉन्गिट्यूडनल। बात समझ में आ रही है, राइट? सो वी हैव गॉट क्रिप्टोस्पोरिडियम, साइक्लोस्पोरा एंड आइसोस्पोरा। Cryptosporidium you can differentiate on the basis of size, that is going to be smallest one 4 to 6 micron. Cyclospora is going to be looking like a cycle, complete cycle 8 to 10 micron is going to be there, and isospora is going to be longitudinal, eye is looking like eye, right? So this is going to be longitudinal. How to differentiate between these two? Crypto is going to be complete, whereas the cycle is going to be cyclical change are going to be there, some of them are stand, some of them are not stand, right? So this is going to be what, this is going to be completely 4 to 8 micron, this is going to be in the favor of what, cryptosporidium parvum, cryptosporidium parvum, right? So let's try to understand some other causes of dysentery and diarrhea we are having. So dysentery means you already know, that is going to be what, that is going to be diarrhea along with the blood or mucus, right? So first cause is going to be Campylobacter jejuni, which has got some association with the Guillain-Barré syndrome. Entamoeba histolytica we have discussed. Histo means tissue, tissue lytica, tissue को तोड़ेगा तो amoebic dysentery करा देगा. It can even lead to liver abscess also, liver abscess, right? This is what we have seen. E. coli में you have learned about 5 strains. These are your pitta strains, okay? Enteropathogenic, invasive, toxigenic, H for hemorrhagic and A for aggregative, right? Out of them, these two, I and H, these are going to cause what? Enterohemorrhagic means it is going to cause hemorrhagic uremic syndrome, O157H7. This has been asked previously, very very important, right? This is going to cause what, dysentery. Another one is going to be enteroinvasive. It is going to go into the cells and it is going to cause what, invasion, and invasion will lead to what, invasion will lead to again bleeding, right? In Shigella we have learned about that Shigella like toxin which is going to inhibit the protein synthesis, leading to what, bloody diarrhea, right? So this is going to be the important causes of dysentery, right? For watery diarrhea we can have what, Clostridium difficile. This is going to cause what, PMC. What is PMC? Pseudomembranous colitis. Pseudomembranous colitis, most common cause, and the drug of choice for this particular one is going to be what, Fidoxamicin. Fidoxamicin is the drug of choice, and second drug that you can apply, second line, is going to be oral vancomycin, right? If it is not corrected by these two, you can go for what, you can go for fecal microbiota transplant. Clostridium perfringens can cause gas gangrene. It can also cause what, watery diarrhea. ETC, toxigenic or traveler's diarrhea, that is also going to be watery diarrhea. Protozoas like Giardia, Cryptosporidium parvum is going to cause what, watery diarrhea. Vibrio cholera can cause rice watery diarrhea. Viruses can cause, like rotavirus, norovirus can also cause what, diarrhea, right? And pea soup diarrhea is something you will be finding with the typhoid, right? So these are some basic causes of diarrhea that we are having, and the treatment of this diarrhea are going to be simple. You take what, you take ORS, that is going to be rehydration, basically rehydration, and then you try to identify the cause. If it is a bacterial cause, you can give antibiotics. If it is a amoebic cause, you can give what, anti-amoebics to the patient, and this patient will be fine. If it is a viral cause, you give what, rehydration to the patient, try to solve the cause, and automatically your patient will be fine, right? So this is about the discussion, right? The next question we are having, a male patient exhibited symptoms of fever and chills. This patient is having what, symptoms of fever along with the chills, right? Fever with chills. The rapid test indicated a positive result for some specific antigens like HRP2. Based on the information, which species of Plasmodium is going to be most likely responsible for causing this infection? Right? So this test that you are having in front of you, this test is known as what? This test is known as what? Card test, beta. This test is known as what? Card test. And they have asked you one question. This card test are based on which principle? So they are based on immune reaction. So immuno, and chromato means it is going to show you some color, and graphy means you can appreciate this thing. This is going to be what, based on a principle known as immunochromatography, right? They have either put it some antigen or either put it some antibody or some reactive substance that is going to react, and this is going to give you color and you can identify the thing. Okay, I hope you remember this. Can you tell me which one is valid, which one is invalid? This one is valid or not? What about this test? Let me mark the numbers and you try to tell me which one is valid, which one is invalid. So out of these one, which one is going to be invalid one? Which test I'm going to reject as soon as I see them? I go to the market, I brought something, and I'm going to throw them away. Some of them I'm not going to use. So which one I'm not going to use? 1, 2, 3, 4, 5. Fourth one you are not going to use. Yes. This fourth one I'm not going to use. Why? Very good, Henry. Not just fourth I'm going to throw, I'm going to throw the fifth one also, right? I told you the first important thing you will always look at is the, okay, let me give you understanding. टू को भी भगाऊंगा, टेस्ट करने के बाद में तो सारी भगा दूंगा ना, but before testing which one I'm going to use, which one I'm going to throw, let me give you basic understanding. देखो होता क्या है, how this thing is going to be there. Is there anyone who is studying micro for the first time along with me right now? ये सारे तुम लोग पहले पढ़ के आए हो? किसी ने माइक्रो छोड़ तो नहीं रखा? ओके, सो लेट्स ट्राई टू अंडरस्टैंड. देखो ये कैसे होता है, इसको हम लोग समझते हैं ना. इम्यूनोक्रोमेटोग्राफी का प्रिंसिपल क्या है? व्हाट इज द प्रिंसिपल? अब एक एंटीजन डालोगे, ये फिफ्थ कॉज पोस्टुलेट है. कोई भी एंटीजन डालोगे तो एंटीबॉडी आके रिएक्ट करेगी. दिस इज द फिफ्थ कॉज पोस्टुलेट. अच्छा, तो समझ में आ रहा है तुम लोगों को? All right, no issues, you will understand. Just go through the videos, you will understand, right? If you find any difficulties, do come back to me, I'll help you out. Okay, so we have got this particular thing, antigen and antibody reaction. This is your fifth Koch postulate है ना. ये कोच ने, रॉबर्ट कोच ने दिस हैज गिवन द कोच पोस्टुलेट. और इस कोच पोस्टुलेट में क्या था, हर एंटीजन एंटीबॉडी के साथ में रिएक्ट करेगा. अभी देखो यहाँ पर क्या दे रखा है, ये जो होता है दिस इज गोइंग टू बी द कार्ड टेस्ट. ऐसे जो टेस्ट होते हैं ना, हम लोग प्रेगनेंसी के लिए भी यूज़ में लेते हैं, कोविड-19 के लिए भी यूज़ में लेते हैं. जो भी टेस्ट मार्केट में आते हैं, दिस टेस्ट आर नोन एज व्हाट, इन टेस्ट को क्या बोलते हैं हम लोग? कार्ड टेस्ट बोलते हैं बेटा. ठीक है, दे आर बेस्ड ऑन इम्यूनोक्रोमेटोग्राफी प्रिंसिपल. यानी इसमें कुछ ना कुछ कलर आएगा, यानी इसमें कुछ ना कुछ लाइंस आएगी. सम लाइंस आर गोइंग टू बी देयर विच आर गोइंग टू बी विजिबल, एंड ऑन द बेसिस ऑफ दीज लाइंस वी विल अप्रिशिएट वेदर दिस इज अ करेक्ट एक्सप्लेनेशन, वेदर दिस टेस्ट इज पॉजिटिव और नेगेटिव, राइट? बट ये इतने ज़्यादा रिलायबल नहीं होते, बहुत ज़्यादा रिलायबल नहीं है. देयर माइट बी पॉसिबिलिटीज यू कैन गेट फॉल्स पॉजिटिव और नेगेटिव रिजल्ट्स, है ना. बट फॉर द टाइम बिंग इट इज़ गोइंग टू बी गुड. 70-80% सेंसिटिविटी इनकी रहती है. सो वी आर गोइंग टू डू दिस फॉर द प्रिलिमिनरी डायग्नोसिस, राइट? सो लेट्स ट्राई टू अंडरस्टैंड. सो देखो, वी आर टॉकिंग अबाउट अ डिजीज. पेशेंट को क्या दे रखा है? एक मेल पेशेंट है. 16, क्वेश्चन नंबर 16, a male patient is there. पेशेंट को सिम्टम दे रखा है फीवर along with the chills, फीवर विद चिल्स, है ना. अगर किसी को फीवर विद चिल्स दे रखा है, विच स्पीशीज ऑफ प्लाज्मोडियम इज मोस्ट लाइकली टू बी रेस्पॉन्सिबल? फीवर विद चिल्स विद हिपेटोस्प्लीनोमेगेली. फीवर क्या देखोगे बेटा? फीवर विद चिल्स विद हिपेटोस्प्लीनोमेगेली, है ना. आप स्प्लीन पाल्पेट करो, पेशेंट को लेटाओ, नीज को फ्लेक्स करो, यू पाल्पेट द स्प्लीन ऑफ दिस पेशेंट, यू विल फाइंड द स्प्लीन इज बिगर. ये स्प्लीन यहाँ से इधर तक बड़ा आपको मिलेगा, है ना. पेशेंट को बोलो मुंह से सांस लेगा, एंड यू पाल्पेट एंड यू फील इट विद योर लेटरल साइड ऑफ द फिंगर, और आपको महसूस होगा, यू विल अंडरस्टैंड द स्प्लीन इज गेटिंग बिगर. अब स्प्लीन बड़ा कब होगा? वेन एवर स्प्लीन इज ऑल्सो नोन एज, बचपन में पढ़ा था, स्प्लीन इज ऑल्सो नोन एज ग्रेवयार्ड ऑफ आरबीसी. यस और नो? स्प्लीन इज नॉन एज ग्रेवयार्ड ऑफ आरबीसी। और अगर बॉडी के अंदर आरबीसी ब्रेक होगा, कौन सी डिजीज में ब्रेक होता है आरबीसी? ये तो सर मलेरिया में होता है। इन मलेरिया वी आर गोइंग टू हैव व्हाट? RBC breakdown, and due to breakdown of RBC, what will happen? Breakdown of RBC, this RBC will go and get accumulated in the liver, in the spleen, and you will be having what is splenomegaly. And due to breakdown of this RBC, you will be having release of a substance that is known as what? Hemozoin, है ना, हमने साइकिल पढ़ा था। तो हीमोजोइन निकलेगा, एंड दिस हीमोजोइन इज गोइंग टू बी रिस्पॉन्सिबल फॉर द चिल्स। तो इस पेशेंट को क्या होगा? आरबीसी टूटने से प्रोस्टाग्लैंडिन्स निकलेंगे। कोई भी सेल टूटेगा तो क्या निकलेगा उसमें से? प्रोस्टाग्लैंडिन निकलेगा। सेल इज द बेसिक स्ट्रक्चरल फंक्शनल यूनिट ऑफ बॉडी, है ना। और कोई भी सेल की मेम्ब्रेन किसकी बनी होती है? फॉस्फोलिपिड की, राइट। सो फॉस्फोलिपिड इज गोइंग टू ब्रेक डाउन विद द हेल्प ऑफ फॉस्फोलाइपेज A2, यू विल बी हैविंग फॉर्मेशन ऑफ एरेक्टोनिक एसिड लीडिंग टू फॉर्मेशन ऑफ प्रोस्टाग्लैंडिन। सो सेल इंजरी विल लीड टू व्हाट? यहाँ पर सेल इंजरी विल लीड टू रिलीज ऑफ प्रोस्टाग्लैंडिन, एंड दिस प्रोस्टाग्लैंडिन विल लीड टू व्हाट? पेन, फीवर। इसका फंक्शन क्या होता है? पेन, फीवर, इन्फ्लामेशन एंड इंक्रीज इन म्यूकस प्रोडक्शन। तो इस पेशेंट को क्या होगा? इस पेशेंट को कफ हो सकता है, इसकी म्यूकस बढ़ जाएगी, इस पेशेंट को इन्फ्लामेशन हो सकती है, दिस पेशेंट माइट हैव फीवर, दिस पेशेंट विल बी हैविंग पेन। सो एनी पेशेंट कमिंग टू यू विद फीवर, chills, hepatosplenomegaly, you will think about what? Sir, something is happening in the patient related to the RBCs, related to the RBCs. Now we will understand this patient might have what? Malaria हो गया सर शायद इसको, है ना। तो मलेरिया हो गया तो कैसे आइडेंटिफाई करेंगे? फर्स्ट थिंग यू कैन डू, यू कैन आइडेंटिफाई द स्पीशीज। व्हाट आर द 5 स्पीशीज ऑफ मलेरिया? Falciparum, malaria, vivax, oval, and the last species which we are having, this is going to be Plasmodium knowlesi, right? So we have got 5 species of Plasmodium. Malaria is due to प्लाज्मोडियम। मलेरिया किसकी वजह से होता है? प्लाज्मोडियम की वजह से होता है। और इस प्लाज्मोडियम को कौन ट्रांसमिट करता है? उस द ट्रांसमिटर ऑफ प्लाज्मोडियम, दैट इज गोइंग टू बी योर female anopheles. Female anopheles is the mosquito which is going to transmit this malaria, है ना। अब देखो हमारे पास में एक पेशेंट आ गया, ऑल द सिम्टम्स आर गोइंग टू बी देयर। सो व्हाट वी आर गोइंग टू डू? वी आर गोइंग टू डू अ कार्ड टेस्ट। अब ये कार्ड टेस्ट जो है, सारी 4 स्पीशीज जितनी भी है ना, ये नीचे वाली जो 4 स्पीशीज, या फिर यू कैन से ऑल दिस 5 स्पीशीज आर गोइंग टू हैव वन थिंग इन कॉमन। इनके अंदर एक एंटीजन कॉमन होता है। व्हाट इज दैट एंटीजन? इनके अंदर होता है एल्डोलेस, eldolase and LDH. These are the 2 antigens which are going to be common, which are going to be the antigen which are going to be present here, है ना। तो ये दोनों चीज़ें इसके अंदर प्रेजेंट होती है। अगर इनमें से कोई सी भी स्पीशीज़ है, कोई सी भी स्पीशीज़ है, तो ये रिएक्ट करेगा इस डिवाइस के साथ में, बिकॉज इट हैज़ गॉट व्हाट? एंटीबॉडीज़। और जब ये दोनों रिएक्ट करेंगे तो इसकी वजह से एक कलर और एक लाइन आ जाएगी, कलर, और यू कैन से सम लाइन इज गोइंग टू अपीयर, राइट। दिस इज द बेसिक प्रिंसिपल, राइट। अगर ये चीज़ें प्रेजेंट है, एंटीजन प्रेजेंट है, तो एंटीबॉडी हम लोग ऑलरेडी इसके अंदर डाल के रखते हैं। सो जैसे ही एंटीजन आएगा ये रिएक्ट करेगा, रिएक्ट होने की वजह से कलर चेंज हो जाएगा, एंड यू विल बी हैविंग अपीयरेंस ऑफ अ लाइन। एंड जैसे ही लाइन दिखेगी यू विल अप्रिशिएट, ओके सर दिस पेशेंट इज हैविंग मलेरिया, है ना। तो बेसिक फर्स्ट प्रिंसिपल समझ में आया कि इनके पास में एंटीजन है। व्हाट इज द नेम ऑफ द एंटीजन? एल्डोलेस और LDH। इस किट के अंदर क्या है? ऑलरेडी एंटीबॉडी इज देयर। वेन एवर वी आर गोइंग टू पुट एंटीजन, व्हाट विल हैपन? एंटीजन एंटीबॉडी रिएक्शन विल हैपन, यू विल बी हैविंग कलर चेंज, and we can appreciate, that is why it is known as immuno, means immune reaction is going to take place, chromato means color, and graphe means you can appreciate, right? But the important thing, ये चारों जो स्पीशीज़ है मलेरिया की, ये कॉमन है, ठीक है। इनकी वजह से जो भी मलेरिया होता है वो बहुत ज़्यादा डेंजरस नहीं है। द मोस्ट फेटल मलेरिया और सेरिब्रल मलेरिया इज ड्यू टू व्हाट? फेल्सीफेरम। द फेल्सीफेरम कैन कॉज सेरिब्रल मलेरिया। तो फेल्सीफेरम के लिए हमारे पास में एक स्पेसिफिक एंटीजन होता है, दिस इज नोन एज HRP2, and this HRP2 is what? Histidine rich protein 2. Histidine rich protein 2 has been asked previously in your exam. तो ये जो एंटीजन है ये स्पेसिफिकली कहाँ प्रेजेंट है? ये सिर्फ और सिर्फ कहाँ प्रेजेंट है? फेल्सीफेरम के अंदर। दिस इज एंटीजन विच इज प्रेजेंट इन फेल्सीफेरम। तो अगर किसी पेशेंट को फेल्सीफेरम वाला इन्फेक्शन है तो उसके अंदर क्या पॉजिटिव आ जाएगा? उसके अंदर HRP2 पॉजिटिव आ जाएगा। इफ द पेशेंट इज हैविंग फेल्सीफेरम इन्फेक्शन, दिस HRP2 शुड बी कमिंग आउट टू बी positive, it should be coming out to be positive. Okay, all right. So now in our case, what is the interpretation? Now let's try to understand. है ना। और एक लाइन जो हर टेस्ट के अंदर पॉजिटिव होनी चाहिए, तभी हम उसको वैलिड मानेंगे। जैसे ही हम लोग किसी भी किट को खरीदते हैं, इट शुड बी हैविंग अ कंट्रोल लाइन शुड बी देयर। इस सी फॉर कंट्रोल है, सी फॉर कंट्रोल, सी फॉर कंट्रोल लाइन शुड बी देयर। अगर कंट्रोल लाइन नहीं है, इफ कंट्रोल लाइन इज एब्सेंट, दिस टेस्ट इज कंसिडर्ड इनवैलिड, है ना। दो चीज़ें और लिखी होगी, एक लिखा होगा पी एफ, दैट मीन्स प्लाज्मोडियम फेल्सीफेरम, and this p all or p and that is written pan or p all that is written, that is for the all antigen, that is for the all antigen. What are the all antigen? Aldolase or LDH. And this pf is for what? This pf is for the HRP2 एंटीजन, राइट। तो हम लोग ऐसे देखेंगे। सो लेट्स ट्राई टू अंडरस्टैंड क्या होगा यहाँ पर। अब देखो ये वाला टेस्ट है, दिस इज गोइंग टू बी, हम लोगों ने यहाँ पर सैंपल डाला, सैंपल डालने के बाद में कंट्रोल लाइन वाज ऑलरेडी देयर, बट देर इज़ नो पॉजिटिविटी ऑफ पी ऑल, देर इज़ नो पॉजिटिविटी ऑफ पी एफ। दैट मीन्स इस पेशेंट को मलेरिया है क्या? दिस पेशेंट इज हैविंग मलेरिया, यस और नो? नो सर, दिस पेशेंट डू नॉट हैव मलेरिया, बिकॉज ना तो पी ऑल पॉजिटिव आया, ना पी एफ पॉजिटिव आया, बिकॉज ना तो HRP2 एंटीजन है, ना ही एल्डोलेज है, ना ही LDH है, nothing is going to be there, so this is a negative for malaria. Another test, क्या मैं इस पे बिलीव कर लूँ? Maybe if symptoms are correlated, I can go for another testing. Further testing हम करा सकते हैं, हम लोग ब्लड सैंपल लेके स्मीयर बना के उसके अंदर देख सकते हैं। I've taught you those things in the full lecture, है ना, तो वो भी देख सकते हैं। Second test we are having is going to be what? ये वाला देखो, इसके अंदर क्या है, कंट्रोल लाइन पॉजिटिव है क्या? ये वाला देख लो चलो पहले, राइट। इसके अंदर कंट्रोल लाइन पॉजिटिव है, यस सर, कंट्रोल लाइन इज पॉजिटिव। व्हाट अबाउट द अदर थिंग? पी ऑल इज पॉजिटिव बट पी एफ इज नेगेटिव। पी एफ इज नेगेटिव मीन्स विच एंटीजन इज मिसिंग? HRP2 इज मिसिंग हियर, राइट। तो क्या ये फेल्सीफेरम है? नहीं सर। क्या इसको मलेरिया है? हाँ, इसको मलेरिया तो है, बट कौन सा नहीं है? मलेरिया इज प्रेजेंट और नॉट? यस, मलेरिया इज देयर, बट कौन सा नहीं है? फेल्सीफेरम का नहीं है, राइट। क्या इस पेशेंट में मलेरिया है? Yes, sir, all lines are coming positive. This patient is having malaria. Yes, positive. And what kind of malaria this patient is having? Sir, falciparum भी positive आ रहा है, तो HRP2 positive है। इस patient को आप ढंग से ट्रीट करो, otherwise this patient can have what issues? This malaria can go to the brain and this patient might have what? This patient can also have what? Cerebral malaria, है ना। So this is how we are going to appreciate this thing, and this is how we are going to solve our questions also, right? So this patient is having what? HRP2 positivity is there, plasmodium is there. So HRP2 positivity अगर आ गया तो कौन सा मलेरिया है? That is going to be plasmodium falciparum. We need to take care of this patient very nicely. Did you understand this? Is that okay? Okay. The next question we are having, what could be the likely cause of the patient's seizure given the provided MRI image of the brain? Try to solve this one. What could be the cause of the disease here? Just a minute. Let me resolve this. Just a minute. All right. So what could be the diagnosis here? All of you are marking the solium, tinea solium. So what happens with this tinea solium? Patient is given what seizures, है ना? मैंने एक चीज़ बताई थी. I told you one thing in the brain, like you have got multiple layers, dura matter, arachnoid matter, pia matter, और उसके नीचे brain parenchyma, है ना? I told you जब भी meningitis होगा पेशेंट के अंदर तो क्या सिम्टम्स आएंगे? फीवर होगा, न्यूकल रिजिडिटी होगा, हेडेक होगा, है ना? लेकिन जब भी ब्रेन पैरेनकाइमा involve होगा, brain parenchyma will be having what, those sulci, those gyri will be there. Whenever you will be having involvement of brain parenchyma, you will be having what, seizures. पेशेंट को क्या हो सकते हैं? सीजर्स हो सकते हैं. दिस सीजर्स आर गोइंग टू बी व्हाट, नॉट टिपिकल, इट इज गोइंग टू बी एटिपिकल टाइप ऑफ सीजर्स, है ना? तो सीजर्स मतलब सीजर्स कब बोलते हैं? सीजर्स और एपिलेप्सी, सिंपल. सीजर इट विल बी हैविंग एनी कॉज बिहाइंड इट, राइट? सो सीजर मतलब कोई ना कोई कारण है. क्या रीजन है? सर ब्रेन के अंदर कुछ कीड़ा है ना, दिमाग का कीड़ा, दैट इज गोइंग टू बी व्हाट, कॉजिंग सीजर्स, राइट? एंड एपिलेप्सी में क्या होता है? विदाउट, विद और विदाउट, बेसिकली विदाउट एनी कॉज, 2 और मोर एपिसोड्स आर गोइंग टू बी देयर, दैट इज कंसिडर्ड एज व्हाट, एपिलेप्सी, है ना? सीजर में क्या होगा? देर विल बी अ कॉज, ऑलवेज देर विल बी अ कॉज. बुखार की वजह से हो रहा है, फेब्राइल सीजर, सटल सीजर्स, न्यूनेटल सीजर्स, राइट? तो ये सारे इनके पीछे क्या होगा? कॉज होगा, है ना? तो जब भी ब्रेन पैरेनकाइमा इन्वॉल्व होगा, या फिर इसी को हम लोग क्या बोलते हैं, जब इन्फ्लामेशन होगा इन तीनों लेयर्स का, दिस इज कंसिडर्ड एज meningitis. व्हेन यू हैव इन्फ्लामेशन ऑफ ब्रेन पैरेनकाइमा, दिस इज कंसिडर्ड एज encephalitis, right? So you can have what, inflammation of this meninges, that is going to be meningitis. Inflammation of brain parenchyma is going to be what, encephalitis, right? And if you have both involvement, अभी कुछ टाइम पहले यू हैव अ डिजीज, है ना, उसमें दोनों का इन्वॉल्वमेंट हो रहा था, प्राइमरी अमीबिक मेनिंगो एंसेफेलाइटिस. मेनिंगो एंसेफेलाइटिस मतलब दोनों का इन्फ्लेमेशन अगर हो गया साथ में, पूरे ब्रेन में इन्फ्लेमेशन है, दिस इज मेनिंगो एंसेफेलाइटिस, है ना? देखा था ब्रेन ईटिंग अमीबा, राइट? सो दिस इज योर टीनिया सोलियम. टीनिया सोलियम में क्या हुआ? दिस सिस्टी सर्कस इज द नेम ऑफ द लार्वा. सिस्टी सर्कोसिस, सिस्टी सर्कस, right? When it goes to brain, it will convert into what, neurocysticercosis, neurocysticercosis, shabash, right? And this is going to be the radiological finding. On radiological finding you will be finding what, पेशेंट को क्या होगा? एटिपिकल सीजर्स आएंगे. सीजर्स जनरली आर गोइंग टू बी व्हाट, फोकल सीजर, मतलब एक जगह से अगर ओरिजिन हो रहा है तो फोकल सीजर. आधे दिमाग से हो रहा है, पार्शियल सीजर. कंप्लीट ब्रेन में एक्टिविटी है, जीटीसीएस, जनरलाइज्ड टॉनिक क्लॉनिक सीजर्स, है ना? तो यहाँ पर कैसे सीजर्स होंगे इस पेशेंट को? एटिपिकल सीजर्स आर गोइंग टू बी देयर, है ना? Atypical seizures are going to be there, and that too is because of the organism. This neurocysticercosis in the brain is causing what, atypical seizures, right? The drug of choice for this particular situation is going to be what, albendazole. क्या दे देंगे इस पेशेंट को? ठीक हो जाएगा. एल्बेंडाजोल दे दो इस पेशेंट को, ही विल बी फाइन, राइट? टीनिया सोलियम, इट इज ड्यू टू पिग, राइट? पिग इज गोइंग टू बी द इन्वॉल्व हियर, राइट? सेजिनाटा में मैंने बताया था टी आ रहा है तो कैटल इन्वॉल्वमेंट विल बी देयर, एंड दिस इज जनरली कॉजिंग व्हाट, टीनियासिस. टीनियासिस में क्या होगा? जनरल इन्फेक्शन ऑफ द जीआईटी which is having just the diarrhea. दिस पेशेंट को क्या होगा? टीनिया सेजिनाटा वाला डायरिया होगा, राइट? इकाइनोकोकस हम लोगों ने पढ़ा था. इकाइनोकोकस इज गोइंग टू बी डॉग टैपवर्म, इकाइनोकोकस granulosus, right? And this is going to cause what, hydatid cyst. This is going to cause what, hydatid cyst, है ना? इसमें भी हम लोगों ने इन्वॉल्वमेंट पढ़ा था. we have learned about the involvement, that is going to be liver followed by lung followed by brain, LLB, right? And for this hydrated you are going to do a surgery. What kind of surgery? That is known as surgical procedure that you are going to do. Treatment is going to be what, pair surgery. Pair, remember pair surgery. एक होता है अमीबिक एब्सेस, एक होता है अमीबिक एब्सेस, एक होता है hydrated, right? So this is going to be what, hydrated due to echinococcus granulosus, right? And this schistosoma hematobium is going to cause what, this is a trematode. This is coming under trematoda, right? We have learned cystoda, trematoda, nematoda, है ना? तो cystoda में हम लोगों ने पढ़ा था बेसिक डाइफाइलोबोथ्रियम लेटम पढ़ा था, एचनाना पढ़ा था, एकाइनोकोकस ग्रेनुलोसिस पढ़ा था, टीनिया सोलियम और टीनिया सेजिनाटा, ये 5 चीज़ें कहाँ पढ़ी थी? फर्स्ट सिस्टोड में। ट्रेमेटोड्स में वी हैव लर्नड अबाउट द फैमिली, इन दैट फैमिली यू विल बी हैविंग व्हाट? सिस्टोस्टोमा hematobium, and this hematobium is going to cause what? T for trematoda, it is going to cause what? Terminal hematuria. Remember terminal hematuria, it is going to have a spine, ये पूरी फैमिली में अलग होते हैं, सिस्टोसोमा है ना, it is going to have terminal spine causing what? Terminal hematuria, and it can be present in the bladder, it can lead to squamous cell carcinoma of bladder, squamous cell carcinoma of the bladder, right? So this is going to cause what? Hematobium, right? So answer in this case is pretty simple. Now you will be marking answer number A. This is going to be Taenia solium, right? The next infection, parasitic. Which infection is characterized by the presence of bloody diarrhea? Again, the bloody diarrhea. Bloody diarrhea means abscess. Bloody diarrhea means that is going to be dysentery. Patient is also having what? Liver abscess. Liver abscess and hydrated are different thing. Hydrated is due to echinococcus granulosus. Liver abscess is due to something else, right? Patient is having right upper quadrant pain. Simple understanding. On histology colon biopsy, we are finding what? Flask shape ulcer. Typhoid ulcer is going to be seen in the cases of uh, typhoid. Will be having what kind of ulcer you will be finding in the typhoid, what kind of ulcer you will be finding in the TB, है ना? So here you will be having what? Here you will be having a flask shape ulcer. कैसा अल्सर दिखेगा? ऐसा अल्सर दिखेगा. This is going to be your mucosa, your submucosa. So here you will be having this type of ulceration will be there. We already know submucosa will be having blood vessels and glands, right? And if there is any kind of lesion in the submucosa, what will happen? Definitely it will be having blood vessels leading to what? Bleeding, right? And that blood will mix with the diarrhea. This is going to cause what? Bleeding, bloody diarrhea, है ना? तो ये क्या हो जाएगा? डिसेंट्री हो जाएगा, राइट? डिसेंट्री विल बी देयर, एंड व्हेन इट विल कम इनटू दिस पर्टिकुलर एरिया, इट विल कम इन द कांटेक्ट विद द ब्लड, और ये ब्लड के साथ में कहाँ चला जाएगा? लिवर में चला जाएगा, कॉजिंग व्हाट? लिवर एब्सेस, है ना? टाइफॉइड, टाई लंबी होती है, टाई इज गोइंग टू बी लॉन्जिट्यूडनल, दिस इज गोइंग टू बी द लॉन्जिट्यूडनल अल्सर, राइट? दिस इज गोइंग टू बी द लॉन्जिट्यूडनल अल्सर. टीबी में होगा ट्रांसवर्स अल्सर, टी फॉर टीबी, टी फॉर ट्रांसवर्स अल्सर. हियर यू विल बी हैविंग अमीबा, अमीबिक अल्सर इज गोइंग टू बी flask shape ulcer, right? So here the options we are having is going to be what? Colon biopsy, flask shape ulcer, right? First one is going to be giardia. Giardia is a very common and important one, right? Giardia में क्या symptom मिलेगा? Giardia is a great grand old man of GIT. What will be the symptom? It is going to cause what? Malabsorption. What is the symptom? Anyone try to tell me what is going to be the symptom? What is the motility we are going to have? You will be having falling leaf like motility. पत्ता गिरा दिया, giardia, falling leaf like motility. Shabash, Henry. You will be having what? Steatoria. You will be having what? Steatoria as a symptom. Steatoria, right? आपको स्टेटोरिया होगा. You will be having fatty stool. Why fatty stool? Because this giardia is going to bind with your colonic mucosa, है ना? ये यहाँ पर जो एब्जॉर्प्शन होना था वो नहीं हो पाएगा, बिकॉज बैक्टीरिया के ये प्रोटोजोआ आके चिपक गया, यहाँ पर पैरासाइट है. So because of that, what will happen? This fat particles will go into the stool, और जब ये fat particles will go into the stool, this is known as what? Fatty stool. You will be having considered as what? Fatty, foul smelling steatoria will be there, foul smelling stool will be there, and you will be having increase in the flatulence, increase gas production will be there, right? This is going to be what? Giardia. It will be having how many flagella? Giardia will be only two flagellate organism you have to remember. One is going to be Giardia, another one is Trichomonas vaginalis. Giardia will be having what? 4 pairs of flagella will be there. 4 pairs of flagella will be there. Total will be 8. And Trichomonas vaginalis, I told you vaginalis will be having V is looking like 5. So 5 flagella will be there in Trichomonas vaginalis, right? So this is going to have 4 pairs of flagella will be there, pear shape or trophozoite will be there, right? This is going to be what? Giardia. Second one is going to be your entamoeba, entamoeba histolytica. Entamoeba matlab, this is going to be entamoeba histolytica. Histolytica means it is going to break the tissue. Histo means tissue, right? So it is going to cause the tissue break, right? Leading to what? Leading to dysentery in the patient. Leading to what? Dysentery in the patient, है ना? इसको कैसे आइडेंटिफाई करोगे? इन द स्टूल यू आर गोइंग टू डू व्हाट? you do the microscopy, you will be finding what kind of cyst? Quadrinucleate cyst. मैंने बताया था दो चीज़ें होती है, एक होता है cyst, दूसरा होता है ट्रोफोजोइट. cyst is the resting form, quadrinucleate cyst. cyst is the resting form, whereas trophozoite जो होता है वो होता है active form. trophozoite is a active और motile form. जो घूमता रहेगा, मोटाइल रहेगा, उसको ट्रोफोजोइट बोलते हैं. जो रेस्टिंग रहेगा उसको बोलते हैं सिस्ट, राइट. सो यू कैन आइडेंटिफाई द क्वाड्री न्यूक्लिएट सिस्ट, राइट. यू कैन टेक आउट द सैंपल. फॉर एग्जांपल यू आर टेकिंग द सैंपल फ्रॉम द लिवर, है ना. आपने ये लिवर में से सैंपल लिया तो यू विल बी फाइंडिंग दिस पस लाइक अपीयरेंस. दिस इज नॉन एज एनकोवी पस अपीयरेंस. एनकोवी पस अपीयरेंस विल बी देयर, राइट. इट इज गोइंग टू कॉज व्हाट? लिवर एब्सेस. और अगर इसके अंदर भी देखोगे तो आपको क्या मिलेगा? यहाँ पर आपको मिलेंगे ट्रोफोजोइट्स. यू विल बी फाइंडिंग व्हाट? ट्रोफोजोइट्स हियर. एंड दिस ट्रोफोजोइट्स आर गोइंग टू हैव व्हाट? एरिथ्रोफेगोसाइटोसिस. एरिथ्रो मतलब आरबीसी, फेगो मीन्स ईट. So they are going to eat the cytosis. So they are going to eat the red blood cells. Trophozoites are going to eat the red blood cells. This is going to show you erythrophagocytosis. In typhoid, you are going to find what kind of ulcer? Tie is going to be long, so you will be having longitudinal ulcer. Whereas in tuberculosis, you will be having transverse ulcer. You will be having transverse ulcer in the tuberculosis, right. So this is going to be about this one, right. And the answer in this case is going to be what? This is going to be flask shape ulcer is given. तो आंसर क्या हो जाएगा बेटा? This is going to be entamoeba. ओके बच्चे, नेक्स्ट थिंग वी आर हैविंग विच हेलमिंथिक इन्फेक्शन. दो चार हम लोगों ने टोटल 10 अंडे पढ़े. 10 में से एक आधा क्वेश्चन आ जाएगा. 10 अंडे याद करना मुश्किल नहीं है. वी हैव लर्नड इन द क्लास इटसेल्फ. सो जस्ट ट्राई टू गो थ्रू दोज एग्स अगेन, है ना. वो हमको याद करने, ठीक है. एक क्वेश्चन हमको मिस नहीं करना. Which helminthic infection commonly associated through soil is characterized by the presence of egg seen in the image below as observed in the stool sample. कौन सा अंडा है ये? What kind of worm is this? Trichuris trichura, also known as which worm? Trichuris trichura, also known as which worm beta? Today no lag beta, no lag from my side. Very high speed internet. Okay. Trichuris trichura, this is going to be what? Whipworm. This is known as whipworm. This ankylostoma duodenale and Necator americanus, these are known as what? These are known as hookworm. These are known as hookworm, right. These are known as hookworm. And this Ascaris is going to be what? Ascaris is going to be the one which is going to have a long body. Different organisms are going to be there in Ascaris, right. This is a egg with the mucus plug, right. This is an egg with the mucus plug. Can you appreciate this mucus plug, right? This is egg with the mucus plug. What is the shape of this egg? The shape of this egg is going to be what? What is the shape of this egg? Are they bile stand? Are they non-bile stand, right? These are important. These are the important things you have to remember, right? First we have seen the cystoda. तो cystoda में हम लोगों ने start किया था Diphyllobothrium latum से, D latum, right? Then we have learned about the nana, H nana, है ना? Hymenolopus nana. Then we have learned about the Echinococcus granulosus. Fourth we have learned about the Taenia solium and Saginata. उसके बाद में हम जब Trematoda पे आए, then we have learned about this infections, है ना? So some of them we have divided them on the basis of the location. Some of them are causing infection in the small intestine, some in the large intestine, right? Some of them are subcutaneous and some of them are filarial worms, right? Yes, it is going to be having dumbbell shape or barbell shape, right? This is the egg of the organism Trichuris trichura. Ascaris में क्या याद रखना है? Ascaris will be having male is going to be different, female is going to be different, right? मुड़ा हुआ कौन सा होगा? हिंदी में याद किया था, मेल मुड़ा हुआ होगा, that is going to be coiled. Male is going to be coiled. यहाँ पर फीमेल कैसी होती है? Female is going to be straight. Female is going to be the straight. And remember, Ascaris lumbricoids will be having a complication you can appreciate. This is going to be associated with intussusception. This is associated with intussusception, right? And these are the eggs of the hookworm. These are the eggs of the hookworm which are having blastomeres. से देखो ये blastomeres से, these are the eggs of the hookworm. So eggs with segmentation, segmentation or blastomeres, this is going to be the eggs of hookworm. This is going to be the eggs of hookworm, right? This is going to be the eggs of hookworm, right? Here you can appreciate this is a male, this is a male, this is a female. One is the male, another one is the female. और eggs अगर मैं बात करूँ, if I talk about the eggs of this particular one, fertilized and unfertilized. Unfertilized, you can remember, unorganized is going to be unfertilized. This is for the ascaris, right? Unorganized will be the unfertilized, right? I'll make you write, don't worry, right? So unorganized will be unfertilized, and fertilized is going to be what? Fertilized egg is going to be what? This fertilized is going to be somewhat organized, है ना? तो जो organized अंडा दिखेगा वो fertilized है, जो पूरा unorganized है वो unfertilized है. किसका अंडा है ये? This is the egg of this particular one. This is the egg of ascaris, right? Ascaris का अंडा है, right? So here this is going to be the Trichuris trichura, right? The next one we are having, I'll tell you about the drug of choice for Trichuris also. Okay, what is the medication used to treat the infection caused by the cystode egg depicted in the image below? So what is the image we are having? What is the egg we are having in front of us? What is going to be the egg we are having in front of us? So what is written here? Look here. Here you are having the egg with the central hooklet and polar filaments. So the egg with the central hooklet and polar filaments. So the egg with the central hooklet and polar filament is going to be the egg of Nana. कौन सा Nana? H. Nana. Hymenolopus Nana. Yes, this is also known as the dwarf worm, right? And the longest or the biggest one is going to be what? This is going to be, biggest one is going to be what? Right? So if you talk about this particular one, praziquantel, what is going to be the drug of choice for this particular one? Drug of choice क्या हो जाएगा यहाँ पर? Cystode हो गया ना ये? This is going to be a cystode. हम लोगों ने 3 फैमिली पढ़ी, cystode, trematodes and nematodes, right? So for all cystode, I can tell you a single drug that can be used for all the cystodes. I'll just give you a simple mnemonic that you can utilize. So for all the cystodes, the drug of choice that you can use is going to be what? Try to tell me. For all the cystodes and all the trematodes. For all the cystodes and trematodes, the same drug of choice will be there. Which one is that? Cystode and trematodes. Yes, for all the platyhelminthes, for all the flatworms, सबके लिए ड्रग ऑफ चॉइस क्या है? शाबाश बेटा, दिस इज गोइंग टू बी व्हाट? praziquantel. This is going to be the praziquantel. For all the cystode and trematodes, you can give what? Praziquantel, है ना? platyhelminth के लिए ड्रग ऑफ चॉइस क्या है? praziquantel. platy is also known as flatworms, है ना? platyhelminths को क्या भी बोल सकते हैं? flatworms बोल सकते हैं. nematyhelminths को क्या बोलेंगे? nematoda. These are going to be what? roundworms, है ना? nematyhelminths are going to be what? roundworms. right? These are going to be your platyhelminths. But what are the exceptions? Exception क्या है? सिस्टोडा वाली फैमिली में हम लोगों ने क्या क्या पढ़ा था? 5 चीज़ें पढ़ी थी. We have learned about the cystodes, right? So what is going to be the exception? For dog tapeworm, also known as Echinococcus granulosus. इसके लिए ड्रग ऑफ चॉइस क्या थी? इसकी वजह से होता क्या? Echinococcus granulosus is going to cause what? Hydrated, right? So hydrated करवाएगा. इसके लिए ड्रग ऑफ चॉइस क्या है? Again, the drug of choice is going to be, this is the exception, the drug of choice is going to be what? Albendazole, right? Echinococcus granulosus, the drug of choice will be albendazole. Yes. Another one is going to be what? Another exception is टीनिया सोलियम that is going to cause what? Neurocysticercosis. उसके लिए भी ड्रग ऑफ चॉइस क्या है? टीनिया सोलियम which is going to cause what? Neurocysticercosis. उसके लिए भी ड्रग ऑफ चॉइस क्या है? ये भी किस में आ गया? सिस्टोड में आ गया, राइट? तो सिस्टोड is going to have echinococcus granulosis and tinea solium. For that the drug of choice is going to be albendazole. Okay, और ट्रेमेटोडा में कौन सा आ जाएगा? This is going to be your fasciola hepatica. For fasciola hepatica the drug of choice is going to be what? This is going to be triclabendazole. Right, this is your exam question. Triclabendazole is the drug of choice for fasciola hepatica. Fasciola hepatica हमने पढ़ा था, क्लोनोर्चिस साइनेंसिस हमने पढ़ा था, लिवर फ्लूक हम लोगों ने पढ़ा था, है ना, लंग फ्लूक, लिवर फ्लूक, paragonymous westermanni, right? So all these things are going to, we can use the same drug, but for fasciola hepatica you need to give what? Triclabendazole, है ना? तो इन दोनों की कहानी क्लियर है, for all the cystode and trematodes the drug of choice will be praziquantel, right? Exceptions will be echinococcus granulosus and tinea solium giving albendazole. This is your previous year last exam question they have asked about this triclabendazole, right? For roundworm the drug of choice is going to be what? Albendazole. For roundworm the drug of choice is going to be albendazole. Here also some exceptions are going to be there, right? What are the exceptions we are going to have? Like for filarial worms like Onchocerca volvulus और स्ट्रोंगिलोइड स्टर्कोरेलिस, स्ट्रोंगिलोइड्स, इनके लिए क्या देना है? बस इनके लिए फिलेरियल वर्म्स के लिए जैसे बुचरेरिया बैनक्रॉफ्टाई हो गया, ब्रूगिया मलाई हो गया, इनके लिए आप लोगों को यूज में लेना है DEC. DEC इज द ड्रग, राइट? डाइथाइल कार्बामाजीन, राइट? For strongyloid and onchocerca you can use what? Ivermectin, right? तो पूरा समरी हो गया यहाँ पर, right? So for all the platyhelminths, for all the nematyhelminths, right? For all the nematyhelminths, for all the platyhelminths, right? Diethyl carbamazine, that is something we are going to give in the cases of Brugia malai, जिनकी वजह से क्या हो सकता है? It can cause what? It can cause elephantiasis. You can have Brugia malai, Wuchereria, Bancrofti, filarial worms, है ना? And then lastly we have got what? Onchocerca volvulus and Strongyloid stercoralis, right? So this is going to be the ivermectin, right? The next question we are having, infection with Clonorchis sinensis is associated with the increased risk of, कौन सा रिस्क बढ़ जाता है इससे? Clonorchis sinensis, फ्लूक्स, Clonorchis sinensis. सर्वाइकल कैंसर किसकी वजह से होता है? दैट इज गोइंग टू बी योर HPV infection, HPV 16, HPV 18, right? 6, 11, 16, 18 can be there. 6, 11 is going to be what? For the laryngeal carcinoma करा सकता है आपको, laryngeal warts करा सकता है. 6, 11, 16, 18, these are the 4, and we have got a vaccination against them also. In PSM also you will study, in OB/GYN also you have studied about the vaccination, right? So we have got bivalent, tetravalent and nonavalent vaccination, like Cervarix, Gardasil and nonavalent Gardasil we are having, right? So that is going to be cervical cancer, right? Within some times it will come to our national immunization schedule also. Nowadays people are buying it and applying it. If you have, if you want, like, you can go for it. It is recommended, right? Next thing is going to be your cholangiocarcinoma. This is going to be due to a Chinese liver fluke, Chinese liver fluke. This is due to Chinese liver fluke, cholangiocarcinoma. That is going to be the bile duct cancer can happen, right? This is going to be due to Chinese liver fluke, right? The name of the liver fluke is Clonorchis sinensis, Gastric carcinoma is due to what? Gastric adenocarcinoma. I told you this is due to a bacteria, that is going to be H. pylori. इसीलिए हम लोग जब भी एंडोस्कोपी करेंगे इन सर्जरी, यू स्टडीड अबाउट दिस, व्हेनेवर यू आर गोइंग टू डू द एंडोस्कोपी यू आर ऑलवेज गोइंग टू टेक द सैंपल आउट, राइट? ये क्या करता है? H. pylori, इसकी वजह से हो जाता है म्यूकोजल एसोसिएटेड टी सेल लिम्फोमा, है ना? पैथो में भी पढ़ा होगा माल्टोमा, राइट? यू कैन ऑल्सो हैव गैस्ट्रिक अडीनोकार्सिनोमा. What is the stain we are using to visualize this particular thing? Is again Warden starry silver stain, right, which is going to give you black color appearance. You can go for urea breath test also, right? You can go for endoscopy, you can go for biopsy, endoscopic biopsy you can do, right? This is something we can do, right? So this particular cell is going to inhibit what? How this thing is working? This bacteria is going to first thing alter the pH, because it is a urease positive organism. It will alter the pH. It will convert urea into ammonia. उससे pH गड़बड़ हो जाएगा. First thing. Second thing, it is going to inhibit the D cells. D cells में से क्या निकलता है बेटा? Normally D cells are going to release what? Somatostatin. In fact, there is a previous year question from INI-CET. They have asked what are the factors which are going to increase the acid secretion except. So what are the factors which are increasing acid secretion? Is H2 receptors, second one is acetylcholine, and third one is gastrin. They are going to increase the acid, है ना? Which one is not increasing the acid? Which one is universal inhibitor? This is going to be somatostatin, which is going to coming out of the D cells. This is going to decrease the acid. It is a very simple question asked in INI-CET, right? So this is how you can understand this thing, right? So somatostatin has got a function. It will inhibit the gastrin release from the G cells, right? And now this bacteria is going to do what? This bacteria is going to kill this delta cells, right? H. pylori is going to kill the delta cells, and if there is no delta cells, what will happen? There will be decrease in the somatostatin. Decrease in somatostatin will lead to increase in gastrin, and increase in gastrin will lead to increase in acid, and this acid will lead to what? Ulcer formation. Simple understanding, right? So the same thing will also happen in one more disease, like you study about tumor of a cell. This is known as what? G cell gastrinoma. G cell gastrinoma, also known as Zollinger-Ellison syndrome, right? The same thing is also happening in the Zollinger-Ellison syndrome, where you will be having increase in the levels of gastrin leading to increase in the acid, and again you will be having ulcer risk, right? And this ulcer can lead to cancer also, right? You can also have two genes involved here. For H. pylori, the genes are CAG and VAN genes. If this particular genes are going to come from a bacteriophage, this normal peptic ulcer causing H. pylori can convert into cancer causing H. pylori, right? This can cause what? Cancer. So this is important. Now about bladder carcinoma, this is due to cystosoma. This is due to cystosoma. Cystosoma has got three things: cystosoma hematobium, cystosoma mansoni, and cystosoma japonicum, right? Cystosoma hematobium is going to cause what? It is going to cause which one is the hematobium, which one is the mansoni, which one is the japonicum? Try to identify which one is hematobium, which one is mansoni, which one is japonicum. A is going to be what? It is mansoni or it is hematobium? Hematobium will be having what? Can cause what? Terminal hematuria. Yes, it can cause terminal hematuria, and because of that terminal hematuria, it can cause what? Bladder cancer. It can cause what? Cancer of the bladder, right? Mansi क्या करेगी? लात मार देगी, right? She is having lateral spine, beta, lateral spine, right? It can cause what? Swimmer's itch, right? This is what we have studied, swimmer's itch. And this particular japonicum, this is going to cause what? Katayama fever. Japanese chotu size spine will be there, right? Rudimentary spine will be there. Rudimentary spine will be there. Shabash, very good. Yes, sir. RSK, Pranav, Obi, Vigneshwaran, Sohrab. Good, right? So this is going to be what? A is going to be having lateral spine. ये लात इधर दिख रही है. This is going to be what? This is going to be mansoni, right? T for terminal spine, T for this is going to be what? Hematobium. It can cause what? Hematobium can cause what? Terminal hematuria leading to what? Bladder carcinoma. And this particular one has got rudimentary spine. This is going to be what? Japonicum, right? These are the family of cystostoma, right? So in this particular question, clonosis cyanosis, the answer will be what? Answer will be B, right? Cholangiocarcinoma, very, very important. The next question we are having is which of the following virus is responsible for this particular presentation? What is this particular presentation? It can be happening anywhere in the body, generally seen in an immunocompromised individual. Immunocompromised individual. What is this appearance is suggestive of? Shabash. This is going to be Kaposi sarcoma. Kaposi sarcoma. What is this Kaposi sarcoma? It is a vascular hemangioma. It is a vascular tumor. Vascular hemangioma. Right? Generally happening in HIV positive individuals, and individuals who are having primary other cancer is going to be there, like lung cancer. Someone is on immunotherapy, someone is on chemotherapy. What can happen? This cancer will get activated. This is a viral condition. This is due to human herpes virus 8, HHV8, and this herpes 8 is going to cause what? Kaposi sarcoma, beta, Kaposi sarcoma. So let's try to learn about the family of this herpes. What is the family of this herpes? herpes का मतलब क्या होता है बेटा? herpes का मतलब होता है grouped vesicle. grouped vesicle. herpes का मतलब होता है grouped, right? herpes means grouped, right? herpes, you have multiple grouped vesicle around the lip. This is going to be what? Vesicle is any lesion. Vesicle will be any clear fluid filled lesion less than 1 centimeter is known as what? Vesicle. Less than 1 centimeter clear fluid filled lesion is known as vesicle. Never touch any clear fluid filled lesion less than 1 centimeter. If you touch, what will happen? Your finger will have herpes, right? And this herpes can transmit in your body. You can have genital herpes, you can have facial herpes, oral herpes around the perioral area. You can have herpes in the eyes also. You can have like which is comprising of that dendritic, very beautiful ulcer you can have. This herpes can also go to your brain. It can cause what? Temporal lobe encephalitis. These are the common locations and identification you should be having, right? So let's try to understand this herpes. We have got HSV1, HSV2, HSV3, HSV4, 5, 6, 7, 8. These are the family of herpes. HSV1, HSV2, HSV3, HSV4, HSV5, 6, 7 and 8. इसकी family में कितने member है? Total members are going to be 8, right? So this is going to be HSV1, which is also going to cause what? This particular type of appearance around the lips. This thing is known as what? Cold sore. इसको क्या बोलते बेटा अपन? Cold sore. This thing is going to be known as cold sore, right? This thing can happen in anyone. Once you have this, it is going to get dormant and it will come back again. For example, sometimes in females are having periods, sometimes females are having immunocompromised situation, or in males also this thing can happen. एक बार हो गया मतलब रहेगा, means it is going to be with you. Is it infective? Is it going to transmit? Yes, if you will touch, come in contact with another person, this is going to be infective. What you need to apply? You need to apply what? You need to apply acyclovir, the drug of choice for herpes. I'm telling you, first time antiviral drug, right? Antiviral are very less used drugs, right? So acyclovir, you can use 400 milligram. You can also use ointment, 400 milligram into 7 days. This is the dose you are going to give to this patient, right? Acyclovir is the drug of choice for herpes. HSV2 is going to be the genital herpes. It is going to be the genital herpes, where also you will be finding what? Multiple grouped vesicle, and these are going to be the painful lesion, right? This is going to be a painful lesion. Painful, only two ulcers. One is chancroid, another one is this herpes, right? So two genital lesions which are going to be painful. One is going to be herpes, another one is going to be chancroid. Chancroid is due to Haemophilus ducreyi. Ducreyi मतलब वो रोता रहेगा. Second one is going to be herpes. You can identify herpes by looking at multiple grouped vesicles. Do not touch this, right? The drug of choice remains the same as acyclovir, 400 milligram TDS 3 times a day into 7 days, right? TDS 3 times a day into 7 days. The treatment remains same, right? You can also give valacyclovir if the patient is not like compliant, right? HHV3 is also known as varicella zoster. This is going to be also known as chickenpox, beta. Not zoster, this is also known as varicella, and this varicella is also known as what? Chickenpox. This varicella is also known as chickenpox. Once you have chickenpox, it will get reactivated. You will be having what? Herpes zoster. Herpes means again grouped vesicle. Zoster means along a nerve segment. Zoster means along a nerve segment. So what is herpes zoster? Herpes zoster means you have multiple grouped vesicle along a particular nerve segment. This is known as herpes zoster. The treatment for herpes zoster is going to be different. This is going to be 800 milligram acyclovir 5 times a day into a week. 7 days, right? This is going to be double dose, right? And you will be having painful lesions. This is going to be definitely painful. You can give like other drugs like pregabalin also, or gabapentin also, right? 300 milligram TDS gabapentin you can also use, right? So this is going to be about the herpes HHV3. Varicella is the common infection we are having. It is going to have what? You will be having varicella. This is going to be a specific appearance. This appearance is known as dew drop on rose petal appearance. Dew drop on rose petal appearance. सबको होता है चिकन पॉक्स, right? All of us are having chicken pox. So dew drop on rose petal appearance, this is known as what? Chicken pox. This is known as what? Chicken pox, right? HHV4 is also known as what? Epstein-Barr virus. This is also going to cause what? This is going to work on like your beta cells. Sorry, not beta. This is going to be causing what? Some cancers, right? This is associated with the cancers, right? Most commonly it is associated with your Hodgkin's lymphoma, non-Hodgkin's lymphoma, right? Nasopharyngeal carcinomas can be there. So all these things can be associated with this Epstein-Barr virus. Very, very important, right? It is associated with Hodgkin's, non-Hodgkin's, your nasopharyngeal carcinomas, your Burkitt lymphoma, right? All these things are associated with this particular simple virus. This is a virus which can cause cancers, multiple kind of cancers. This is your Epstein-Barr virus, which is coming under the group of herpes, right? HHV4, human herpes virus 4. HHV5 is known as cytomegalovirus. This is going to give you a very specific appearance. This appearance is known as intracytoplasmic intranuclear inclusion bodies. This is going to be known as owl eye inclusion body. Owl eye inclusion bodies, right? And the drug of choice for this particular one is going to be not acyclovir, but we are going to use ganciclovir. Ganciclovir, right? So this is going to be a ganciclovir for this particular one, right? So we have learned about HSV1, HSV2, 3, 4 and 5, right? 6, 7 is going to cause what? Exentum subitum, and 8 is going to cause what? Kaposi sarcoma, which is a type of vascular hemangioma, right? So we have to remember this particular family of herpes. This is going to be the HHV. 8 is going to be the answer here. HHV4, it is associated with multiple cancer. This is going to be Epstein-Barr virus. 6, 7 is exentum subitum you can have, right? Try to answer this one. What is the probable diagnosis for a 12-year-old boy who presents to the outpatient department with symptoms of fever, ear pain and swallowing difficulties from the past week? Additionally, the examination you are finding what? Swollen testicles, and the image his jaw is provided below. What is the symptom this patient is having? And one more thing, you will be having viruses divided into DNA and RNA viruses. We are discussing about the first herpes or happy viruses are going to be what? DNA viruses, right? Happy viruses, DNA viruses. Herpes, hepatina, adeno, parvo, pox, papova, right? These are DNA viruses. Herpes, hepatina, adeno, parvo, pox, papova. These are the happy viruses, right? Happy. Apart from that, other are going to be what? RNA viruses, right? What is the probable diagnosis for a 12-year-old boy who present to the outpatient department with the symptoms of fever? Patient is having fever, ear pain and swallowing difficulties are going to be there for the past week. इस patient को क्या हो रहा है? Fever है, multiple things are there, fever, ear pain, right? In the jaw you can appreciate this patient is having what? This patient is having what? Swelling. This patient is having swelling over here, right? For the past week, एक हफ्ता हो गया. Additionally, the examination reveals testicles are also going to get swollen, right? So what is going to be there? Is it a croup? What happens in croup? Croup is due to which virus? Croup is due to para-influenza beta. Croup is due to para-influenza virus. है ना, मैंने पूछा था इन्फ्लुएंजा इज अ बैक्टीरिया, हीमोफिलस इन्फ्लुएंजा इज अ बैक्टीरिया, पैरा इन्फ्लुएंजा इज अ वायरस, राइट? इन्फ्लुएंजा इज अ वायरस, पैरा इन्फ्लुएंजा इज अ वायरस, बट हीमोफिलस इन्फ्लुएंजा इज अ बैक्टीरिया, एंड दैट बैक्टीरिया इज कॉजिंग व्हाट? वो बैक्टीरिया बहुत सारी चीजें कराता है. दैट बैक्टीरिया 3 more are left. No issues. Just try to be with me, है ना? 10-15-20 मिनट, 15 मिनट, 20 मिनट, be with me, we will cover, right? I'll share this PDF along with you, okay? You have another class at 7 or 6:30? Para-influenza, you have studied about this particular one in ENT also, right? In ENT also, 7, okay? Will take 15-20 minutes, okay? So para-influenza, you have talked about this particular thing in ENT also. It is going to characterized by the steeple sign, beta steeple sign है ना. दो साइन पढ़ते हो, एक steeple sign पढ़ते हो, एक पढ़ते हो thumb sign. Thumb sign is something you will be finding with, thumb sign is something you will be finding with the epiglottitis, epiglottitis. And remember, this epiglottitis can be due to Haemophilus influenza B, है ना. ये होता था earlier. Now if examiner is asking, you will be marking your answer as streptococcus, right? This is a common cause nowadays, right? Okay, streptococcus and Haemophilus influenza B, right? Thumb sign is going to be in the epiglottitis, and steeple sign is going to be in the para-influenza. That is going to cause what? That is going to cause what? Croup, right? This is a ENT question, right? Mumps में क्या होगा? In mumps you will be having most common presentation of mumps is going to be what? Parotitis. You will be having parotitis. This can be bilateral parotitis. Second most common presentation is going to be either orchitis you can have, either ophiritis you can have. Either orchitis or ophiritis you can have. It is going to involve what? Testicles. It is going to involve these things, right? This is going to be the also given here. You will be having what? Swollen testicles are going to be there, है ना. पहले हम लोग क्या क्या वैक्सीन करते थे? फर्स्ट अर्लियर वी यूज टू गिव व्हाट? MMR, मीजल्स मम्स रूबेला. नाउअडेज वी आर यूजिंग व्हाट? मम्स सॉरी मीजल्स एंड रूबेला. क्यों मीजल्स और रूबेला यूज में ले रहे हैं? MMR क्यों नहीं यूज में ले रहे हैं? वाई वी आर नॉट यूजिंग MMR? राइट आंसर. And what is the strain for this mumps? The strain for this mumps is going to be what? Zerilin, है ना. ये वैक्सीन का strain है हमारे पास में, Zerilin, right? In rubella you will be finding what? Rubella will be having special spores, right? This is going to be known as what? Forsheimer spores, है ना. Forsheimer spores on uvula you will be finding Forsheimer spores, right, on uvula. आप पेशेंट को आकर नहीं बोलोगे, पेशेंट बच्चे का मुंह खोलोगे, you will be finding what? You will be finding what? On uvula you will be finding Forsheimer spores, and on the body of the baby you will be finding baby will be looking like a blueberry muffin rash will be there. Blueberry muffin rash will be there, right? For rubella, the strain is going to be RA27/3. Remember, right? It can cause what? Congenital rubella also, right? Which is characterized by CHD, right? Measles, what is the strain for measles? That is going to be Edmonston Zagreb. Edmonston Zagreb, right? Measles से क्या बंदा मर जाता है? Yes, measles can cause what? Giant cell pneumonia. Remember, giant cell pneumonia. Giant cell pneumonia also known as H pneumonia. इसलिए measles से बंदा मर जाता है, H pneumonia हो जाता है ना. H pneumonia, giant cell pneumonia. कौन से giant cell? Warden Finkelday giant cells. कौन से giant cells होते हैं? Warden Finkelday giant cells are going to be there, and these giant cells can kill the patient. इसलिए हम लोगों को measles तो लगवाना है ना. इसमें रूबेला से भी बंदा मर जाता है, बट क्या मम्प्स से मर जाता है? नहीं सर, मम्प्स से बंदा नहीं मरता, इसीलिए MMR को हटा के क्या कर दिया? MR कर दिया. मम्प्स से क्या होता है? मम्प्स कैन कॉज स्टर्लिटी. ये किसको इन्वॉल्व कर रहा है? इट इज गोइंग टू इन्वॉल्व व्हाट? ओफराइटिस, ऑर्काइटिस. इट इज इन्वॉल्विंग व्हाट? टेस्टिस एंड ओवरीज, राइट? सो इट कैन कॉज व्हाट? स्टर्लिटी. तो सरकार को स्टर्लिटी के लिए इतना पैसा खर्च करने की जरूरत नहीं, राइट? सो व्हाट गवर्नमेंट हैज डन from national immunization schedule, they have removed this particular thing because there is very less risk of mortality, है ना. तो मतलब हम लोग cost effective देखेंगे. जो vaccines लग रही है, whatever vaccines you are learning, hepatitis B, OPV, BCG, right, all these vaccines that you are watching on a regular basis, national immunization schedule, these are all very very important. अगर नहीं लेंगे तो क्या होगा? disease होगा, है ना. तो वो जो वैक्सीन्स लग रही है वो क्यों लग रही है? ताकि हमको डिजीज ना हो. जैसे जापानीज एंसेफेलाइटिस है, 30% मोर्टेलिटी रेट है ना. 30% मोर्टेलिटी रेट है. कोविड-19 में वो 1 to 2%, है ना. निपा वायरस वो 70%, बट वी डू नॉट हैव वैक्सीन. अभी तो फ्लू के शॉट्स भी लगते हैं. एवरी ईयर पीपल आर टेकिंग व्हाट? फ्लू वैक्सीन्स, है ना, बच्चों में लगवाते हैं, राइट? सो दैट इज हाउ इट इज वर्क, राइट? सो आंसर फॉर दिस पर्टिकुलर वन इज गोइंग टू बी व्हाट? दिस इज गोइंग टू बी मम्प्स, राइट? The next one, what could be the likely diagnosis for a COVID-19 patient who initially presented with fever, Patient is having COVID, fever, nasal congestion and headache was there. Later developed facial pain, numbness हो गया, blackish discharge coming from the face on examination using SDA. SDA मतलब क्या क्या बात कर रहे हैं, फंगस है कहीं ना कहीं. Cotton wool, very very important, cotton wool growth, non-septate hyphae, right angle, obtuse angle were observed on histopathological examination. HNE stain हम लोगों ने डाला, HNE stain वही same pink and blue stain हम लोगों ने डाला, and we are finding this particular thing. So let's try to understand what is this fungus we are having, right? So this fungus we are having is going to be nothing but your very common mucormycosis. Mucormycosis, right? This mucormycosis is also known as rhinocerebral fungus. Rhinocerebral फंगस. वाई वी कॉल इट राइनोसेरिब्रल फंगस. देखो हम लोगों ने जो ऑक्सीजन सिलेंडर्स हम लोगों ने यूज में लिए, वट एवर ऑक्सीजन सिलेंडर्स वी आर टेकिंग, they will be having what spores of the fungus. When we are connecting this oxygen to a diabetic patient, what happens, the spores will go into the nose. Rhino means nose. Once they will go to nose, they will go to the eyes via this particular area. This is known as what? This is the medial border, also known as lamina papracia, which is the thinnest layer, right? So from here what will happen, this infection will come into the eye, and from the eye or from the above area it can cross the cribriform plate, it can go to the brain also, right? So this is a rhinocerebral fungus we are having, which is also known as what? Black fungus, which is also known as black fungus, right? Black fungus, right? This is going to be giving you black color appearance will be there. Black color appearance will be there. And this, what is this black color appearance? This is a dead necrotic tissue. This is a dead necrotic tissue. So first of all, you need to do what? You need to do what? Before giving the treatment, you need to do first line, that is going to be surgical debridement. You need to clear this area. You need to clear this area. Surgical debridement you are going to do, then only you can get the vascular supply. Then you are going to give the drug, which is liposomal amphotericin B, which is liposomal amphotericin B, है ना, तभी तो दवाई दोगे, right? For identification you can go for tissue biopsy also. You can go for tissue biopsy, और tissue biopsy के अंदर आपको क्या मिलेगा? You are going to take the sample. In the tissue biopsy you are going to find like that. This is going to be what? Septate होंगे, aseptate होंगे hyphae. Here you will be having aseptate hyphae with obtuse or 90-degree angle, obtuse angle, right? So you can appreciate here the angle is going to be 90 or more, right? So this is going to be aseptate hyphae with obtuse angle. This is suggestive of what? This is suggestive of this is suggestive of mucormycosis. This is how we make the diagnosis. हमको hyphae मिलेंगे which are going to be aseptate and angle will be more. Another entity is going to be what? This one is your aspergillosis. This one is your aspergillosis. Aspergillus में क्या होगा? You can appreciate the angle between these two things is going to be what? This angle is going to be acute or obtuse. This angle is going to be acute angle. This angle is going to be acute angle. This angle is going to be acute angle. And SP you can find, you will be having what? Septate hyphae will be there. So septate hyphae with acute angle, this is going to be septate hyphae. Can you identify the septations? And this branching pattern is known as what? Dichotomous branching pattern. You can appreciate एक में से दो निकल रहे है ना. So this pattern is known as what? Dichotomous branching. This is going to be suggestive of what? This is suggestive of aspergillus. This is suggestive of aspergillus. तो कैसे डिफ्रेंशिएट करेंगे aspergillus bit और rhizopus में? You can simply understand, right? Bit you can look for the angles. You can look for the angles, right? One more thing they can ask you in mucormycosis, there are only two oral drugs that you can use. One is isavuconazole, and another one is posaconazole. Isavuconazole and posaconazole are the two drugs that we are going to use here, right? So here it is already written that, right, we are finding what? Cotton wound growth, non-septate hyphae, right angle or obtuse angle. Your answer will be what? This is going to be what? Mucormycosis, right? Next one we are having is a 43-year-old patient presented to OPD with the symptoms of fever. Patient is having fever, headache, joint pain is there, petechial rashes, bleeding from the gums. Her profile says hemoglobin is 9, WBC is 3000, platelet count is 22. What is your diagnosis? What is your diagnosis? Your diagnosis will be what? This patient is having what? Thrombocytopenia is going to be there, right? Thrombocytopenia. So for that particular purpose, the normal thrombocyte count is 1.5 to 4.5 lakh, right? This is the normal count. अगर ये कम चला गया, कितने से कम? 30,000 से कम चला गया, we need to go for what? Transfusion. Transfusion में हम लोग क्या चढ़ाते हैं? प्लेटलेट काउंट है, थ्रोम्बोसाइट मतलब प्लेटलेट। अगर किसी का प्लेटलेट कम हो गया तो क्या क्या चीज़ें चढ़ा सकते हो, क्या क्या दे सकते हो इस पेशेंट को? ट्राई टू आंसर, राइट। स्क्रब टाइफस, देर माइट बी पॉसिबिलिटी ये स्क्रब टाइफस हो, है ना। इसका आंसर करो तुम लोग, क्या क्या चढ़ा सकते हो, व्हाट आर द थिंग्स यू कैन गिव टू दिस पेशेंट, ब्लड प्रोडक्ट क्या क्या चढ़ा सकते हो फॉर ट्रांसफ्यूजन, जस्ट ट्राई टू आंसर मी, राइट। सो स्क्रब टाइफस वी आर हैविंग, शाबाश, फ्रेश फ्रोजन प्लाज्मा। Scrub typhus is something which is going to have some lesions, black color scar will be there, black scar will be there beta, always remember black color scar दो जगह याद रखना है, एक तो स्क्रब टाइफस में, दूसरा तुम्हारे याद रखना है तुमको सेकेंड डिजीज इज गोइंग टू बी व्हाट? बेसिलस एंथ्रेसिस। ये दो जगह जहाँ पर ब्लैक कलर के स्कार्स होंगे, राइट, ब्लैक कलर लीशन, both of them has been asked previously. Typhoid, we have seen multiple things we have seen in the typhoid, right? Dengue and malaria, we have seen the treatment of malaria, anti-malarial drugs जाएगा मलेरिया में, anti-malarial, right? And what about dengue? Dengue is a viral disease बेटा, viral disease है, तो इसके अंदर हम लोगों को क्या करना है? वायरल डिजीज में द सिम्टोमेटिक ट्रीटमेंट हम लोग देते हैं। इस पेशेंट को क्या क्या देना है, इस पेशेंट को हम लोग क्या क्या दे सकते हैं? इसको बकरी का दूध पिलाना है, we want to give the goat's milk to this patient, पपीता के पत्ते, papaya leaves, goat milk, और कुछ खमीरा, these things are a big no, right? You need not to give all these things, right? Automatically you can understand the lifespan of this dengue is going to be what? The lifespan of this dengue is going to be approximately 10 days. If it is a normal dengue, first 4 days are going to be what? Fever, which is not going to go away. ठीक है, 5, 6, 7, 8 दिन are going to be the dangerous period where you can have risk of bleeding can be there. Bleeding का खतरा रहेगा, right? And 8, 9, 10 days are going to be the time period when there will be recovery, है ना। प्लेटलेट का लाइफ साइकिल कितना होता है? 7 दिन में तो प्लेटलेट ऑटोमेटिकली बनने लग जाती है, राइट। आपका बोन मेरो तो खराब नहीं है, तो प्लेटलेट बढ़ाने के लिए ये सब चीज़ें देने की ज़रूरत नहीं है, राइट। यू आर नॉट गोइंग टू गिव एनीथिंग फ्रॉम हियर, राइट। this is platelet count will automatically will restart after like 7 days. This platelet will automatically regain, right? अगर कोई हीमरेजिक डेंगू शॉक में जा रहा है, दैट इज गोइंग टू बी अ डिफरेंट स्टोरी, वी हैव डिस्कस्ड अबाउट दैट। बट इफ इट इज अ नॉर्मल डेंगू दैट हैपेंस इन नॉर्मल पीपल, राइट, नॉर्मल पीपल में जो डेंगू होता है, फर्स्ट 4 days is going to be high grade fever along with the joint pain, all the symptoms are going to be there, headache will be there, nausea, vomiting can be there, bleeding is not going to be there, right? So other symptoms are going to be there. And remember, this fever is not even subside with the dolo, so you need to go for mechanical like you need to go for physical decrease in the temperature. You will be doing what? Cold sponging in the patient. You will be doing what? Cold sponging. That means you are not going to give what? Cold sponging means you are not going to give cold temperature, it is going to be normal temperature you are going to use, right? और उसके बाद में उसका पेशेंट के पूरी बॉडी पे आप कपड़ा लगा के उसका फीवर डाउन करोगे, राइट। 5, 6, 7, 8 days are going to be the days where you can have a risk of bleeding, and then you will be having recovery, right? You can give NSAIDs, you can give dolo, you can give painkiller, right? इफ़ यू आर गिविंग पपाया लीव्स टू दिस पेशेंट, ये कड़वी होती है, पेशेंट को फिर से वॉमिटिंग होगा। गोट्स मिल्क क्यों बोलते हैं? अर्लियर वी यूज टू ड्रिंक काउ मिल्क और आपका लाइक बफेलो मिल्क, दिस इज गोइंग टू बी डिफिकल्ट टू डाइजेस्ट। सो इस केस में वी यूज टू गिव व्हाट? इस पेशेंट को अगर दूध पिलाना है तो काउ या बफेलो का हटा के गोट्स मिल्क पिलाते थे, तो इसलिए वो कंटिन्यूटी में चलता आ रहा है। कमीरा ऑल्सो समथिंग वी आर नॉट गोइंग टू गिव, राइट। सो दिस इज समथिंग वी विल बी looking at, right? Cold PCM plus sponging plus rehydration is the ultimate thing. The more water you give, मैं starting से एक ही point है, the more water you give, okay, what will happen? more water you give, the more better it will get, right? Yes, we know we have got tablets of papaya leaves also, papaya extract also. That is something, a marketing gimmick, right? Multiple things are there in the market, 90% of them are useless, right? So if you are smart, if you know things, that is going to be good for you, right? The only answer that I'm getting wrong is platelet count. But remember, blood के product हमेशा याद रखना, blood has got two things. Blood has got cells. This is going to be RBC, WBC, and platelets. Another thing is going to be what? Plasma. And this plasma will be having what? This plasma will be having everything, like fresh frozen plasma will be here. Your cryoprecipitate will be here, right? Your four factor complex will be here. Four factor complex will be here. Your plasma proteins are going to be here, right? सब कुछ, इनके अलावा सब कुछ किधर होगा? इधर होगा. अगर मुझे ये प्लेटलेट्स बढ़ानी है तो याद रखना उधर से कुछ नहीं देना. अगर मुझे प्लेटलेट्स कम हो गया तो प्लेटलेट्स बढ़ाना है, तो आई हैव ओनली टू ऑप्शन. आई हैव गॉट RDP, आई हैव गॉट SDP, random donor platelet and single donor platelet, right? Random donor platelet will increase the platelet count by 10,000. एक यूनिट से कितना बढ़ेगा? 10,000. सिंगल डोनर प्लेटलेट विल इंक्रीज द प्लेटलेट काउंट बाय 30,000. एक यूनिट SDP से कितना बढ़ेगा? 30,000. RDP मतलब बहुत सारे रैंडम लोगों का प्लेटलेट है ना. RDP मतलब बहुत सारा रैंडम लोगों का प्लेटलेट है, क्योंकि प्लेटलेट के ऊपर ब्लड ग्रुप नहीं होता. तो आई कैन टेक प्लेटलेट फ्रॉम एनीवन, सबको मिक्स करके आई विल सेल. दिस इज गोइंग टू बी रैंडम डोनर प्लेटलेट आफ्टर ब्लड डोनेशन, है ना. सिंगल डोनर मतलब कोई एक स्पेसिफिक बंदा आपके लिए प्लेटलेट दे रहा है. दिस इज गोइंग टू बी मोर पोटेंट, एंड इट ऑल्सो डज नॉट मैटर हु इज गिविंग प्लेटलेट, है ना, क्योंकि इसमें प्लेटलेट में कोई ग्रुप नहीं है. सो अल्टीमेटली सिंगल डोनर प्लेटलेट इज गोइंग टू बी बेटर, एंड दिस इज हाउ यू कैन करेक्ट योर पेशेंट, राइट. तो इनमें से कुछ नहीं देना, ये सब चीज़ें बेकार है इसके लिए, राइट. यू विल बी यूजिंग व्हाट? ओनली platelet, or maybe whole blood can be given, but the ultimate thing is going to be platelet, and platelet is something which is necessary for primary hemostasis. अगर किसी की बॉडी में फैक्टर्स की कमी है, किसी की बॉडी में फैक्टर 1 2 3 4 5 7 13 तक कोई सा भी फैक्टर कम है, वो बंदा नहीं मरेगा ब्लीडिंग से. बट इफ समवन इज हैविंग डिक्रीज प्लेटलेट, ही इज गोइंग टू डाई, बिकॉज प्लेटलेट इज रेस्पॉन्सिबल फॉर प्राइमरी हीमोस्टेसिस. पहला जो खून का थक्का बनता है वो किससे बनता है बेटा? हीमोफीलिया वाला पेशेंट नहीं मरेगा. बट अगर किसी को एस्पिरिन चल रहा है बहुत लंबे समय से, बहुत ज़्यादा, तो ये ब्लीडिंग से मर सकते हैं. हीमोफीलिया वाला शायद बच जाएगा, राइट. सो दिस इज समथिंग विच इज़ इंपॉर्टेंट. प्लेटलेट इज इंपॉर्टेंट फॉर प्राइमरी हीमोस्टेसिस. जैसे ही कट लगता है तो 2 से 9 मिनट के अंदर खून रुक जाता है. दिस इज द नॉर्मल ब्लीडिंग टाइम, राइट. इट इज़ गोइंग टू बी बेस्ड ऑन द प्लेटलेट ओनली. इट इज़ बेस्ड ऑन द प्लेटलेट. अगर आपका प्लेटलेट काउंट अच्छा है, आप नहीं मरोगे. अगर आपका प्लेटलेट काउंट खत्म है, 20,000 15,000 प्लेटलेट है, आपको ब्लीडिंग नहीं रुकेगी, प्राइमरी ब्लीडिंग नहीं रुकेगी, और ये नहीं रुकेगी तो पेशेंट माइट लूज, राइट. वी कैन लूज द पेशेंट ऑल्सो. सो आंसर इन दिस केस इज गोइंग टू बी डेफिनेटली dengue. Dengue is going to be the diagnosis for this particular patient, right. With this thing we are done with the basic very short and crisp revision that we have got, right. So thank you so much for all the patients, right.